Magana, Guam. This is Guam's favorite, I-94. Calling all graduating seniors. Join us by showing your class pride in the celebration caravan you deserve through the island's major thoroughfares. KUAM and its partners want to recognize your accomplishments and help celebrate this pivotal moment in your lives. To participate, email promotions@kuam.com and let's get this show on the road. Special thanks to ABC Stores Guam and The Dungeon.
Be healthy. Be informed.
By the dawn's early light. inanya gitoru ilugar para y honra, para y gloria, aviva y islasen para y honra, para y gloria, aviva y islasen para Gitoru y tempo y paz para ita dan gini langit na bendición contra y peligro na pansafuham Deus protegis langwong contra y peligro na pansafuham Deus protegis langwong.
Baby, I'm just trying to let you know how I feel. You have no idea. I always think of you. You're on my mind like wind blowing through trees. And when I hold you close, there's no better feeling. You're my boo. I'll do anything for you. Call me wherever, baby. I'll come running to you. You know I love you. Why do you doubt me, boo? Just give me one more chance. What must I do to you? Now that you're gone, I can't do anything. I'm lost. I'm walking in circles, babe. I can't find my spot. Ooh, I can't lie. You are my everything. Why you keep telling me you want nothing with me? I still wanna try to make it alright. I can't sleep at night. I can't close my eyes. I'm tossing and turning. My mind it keeps burning. I'm going insane. I need you, my baby.
All right. Now that that's out of our system, good morning, Guam. 6:18, yes.
Hope you don't run away. I just want
6:18, just right off the bat. A big announcement. I'm pretty sure, judging from our Facebook comments, yeah, they've reached the capacity at the food commodities. So we got the message from the governor's press secretary. No more cars will be allowed to line up in today's emergency food distribution program. They're already at the maximum number of cars in line for today's distribution of 2,000 food bags and boxes. Reminder that on Friday there are 2 locations for distribution. That's T-Gen Baseball Field and the Dedito Farmers Market. So yeah, already we're seeing on the comments at least one person who was turned away. I drove by T-Gen this morning, Bree, and man, around 5 in the morning, that line was
long.
Crazy. It was already stretching out at T-Gen. Shout out to all the GDOE employees and the partner agencies that are assisting with the distribution of these food boxes, because they were up. They had their canopy over there by the softball field, and it was looking very, very busy before they even started passing out these bags. And this has been something that they've tried to work on logistically, stretching back to last week when they were giving it out just at GSA, and we saw the cars.
Mm-hmm.
I mean, wow, all the way to Aspen.
Was there any National Guard members out there? Did you see any?
I didn't see any, but there were. I did see siren siren lights, but it was more towards the Barragata side, and I go that way. So I'm pretty sure that there were some people who were mobilized and activated to help out. So that's rather unfortunate, man. Friday, I guess, got to line up even earlier as the need for food on this island.
And that closed even before it opened. We got that at like 5 something. And it didn't open till 6.
Right. So already they've maxed out the capacity. I don't know. When do we start having the conversation that maybe we need to use some of this CARES Act funding for food assistance, that's one of the things that you can use it for, right?
Mm-hmm. Yeah, definitely. And it's also one of the things that Senator Regine Biscoe-Lee had recommended. One of the options, she was hoping that the governor would use her authority and allow some of that money to be used for food.
Yeah, I believe also there was mass feedings was also something that was in the Treasury guidance. It's very frustrating to know, and we'll talk about this too on the childcare front coming up on a little bit later in the show. Frustrating to know that we're sitting on this huge mountain of money, but just having problems getting it out where it needs to go. I mean, obviously I don't know if it's
Is it a problem?
Is it a problem? I don't know. But, I mean, if we have money that we're sitting on that we could use for food assistance and mass feedings, then, why aren't we using it? Why is there no plan? You would think they would plan ahead and see. I don't know. Maybe if I was in a position, I would look at last week's line and say, man, this is crazy. That line multiplied by grab-and-go meals equals people are still hurting out here. They're still needing assistance, whether it's meals or food that they can take to their house. And I really just want to see a one Guam approach, I mean, look at this need. It's gone. They're gone before they even open. Surely we should be planning ahead already at this stage to say, man, how are we going to meet this demand? And if I'm the governor, I'm going to say, hey, use that CARES Act, boy. Go to Payless, go to Costuless, go to Kmart, buy a bunch of food. Let's just give it out. 622. Hey, good morning, by the way. Yeah, so I just wanted to get that word out to you. That, I mean, I'm sure you already know if you got turned away at that line. That is what's happening. You're frustrated. Give us a call. We would love to put you on 637-0094. The show is all proudly brought to you by Ambrose Inc., IT&E, Coast 360, the Bank of Guam, and Calvo Enterprises. It is the KUAM News Takeover, Guam's favorite, containing COVID. So many ways to catch the show. Right here on the radio, 93.9 FM, KUAM, Hagatnya. Good morning. Also, there's an audio stream, Docomo Channel 10. We're streaming live at KUAM.com and on the KUAM News app. And last but not least, on the Edward R. Murrow Award-winning social media networks of KUAM, good morning. To our KUAM News Facebook Live viewers, you guys are totally legitimate. And thank you. 6:23 now. Let's do it as we always do. We start the show with a deep dive into the day's COVID-19 headlines from the KUAM News team. Good morning, Sabrina Salas-Mantanani.
Hafaday and good morning, everyone. On Tuesday, Public Health tested 64 people and 2 came up positive for COVID-19. There was also 1 probable case of the virus reported after an individual tested positive through serology testing at Diagnostic Laboratory Services, or DLS. Hence, it was classified as a probable case. To date, Guam has 169 cases of COVID-19, 5 deaths, and 139 recoveries. And even before it officially opened at 6 a.m. and no more cars are being allowed to line up at the Guam Department of Education and USDA's Emergency Food Distribution Program site at the Teedson Upper Baseball Field. According to Governor spokesperson Crystal Pacos San Augustine, there are already the maximum number of cars in line for today's distribution of 2,000 food bags and boxes. The Emergency Food Distribution Program continues Friday the 29th. Food will be distributed once again at the Teedson Upper Baseball Field and Dedido Farmers Market. That's from 6 a.m. to 10 a.m. Please note only 2,000 food bags and boxes will be distributed at each site on a first-come, first-served basis. As of this week, more than $11 million in local pandemic assistance payments have been mailed out. On Tuesday, Administration Director Edward Burns says they mailed out another 6,498 checks worth $4,762,000. As of Friday, DOA had mailed out 8,229 checks totaling $6,527,000. A total of $20 million from CARES Act funding was allocated by the governor for the Programan Salapi Adzudini Tautau, or the Money to Help the People program. The last day to apply for the assistance is June 12th on Public Health's website. We'll have to wait a few more days before the issue of double pay is officially heard before the court. Assistant Attorney General James Canto told the court that the AG's office was never served. Last week, Attorney Tom Fisher filed a writ requesting the court to order the government to pay frontliners their double pay. He represents Police Officer Steve DePasnia. He is suing GovGuam, Governor Lulian Guerrero, GPD Chief Steve Ignacio, and DOA Director Edward Byrne. Canto represents all four entities. Here's what happened inside the courtroom of Judge Anita Sokola.
But short answer, Your Honor, I don't know the government's position. Mr. Canto is here, and I assume he is representing the government of Guam.
Thank you, Mr. Fisher. On behalf of the people, Mr. Canto, why has in your office filed your position regarding this petition of writ of mandamus?
Good afternoon. Yeah. Petitioner did not serve us. He did list the government of Guam as a separate defendant, and the Attorney General's office is chief legal officer of the government of Guam by statute, law. So we were not served.
All right.
I think that's correct, but we did serve Guam Police Department, Governor Leon Guerrero, and Mr. Byrne at DOA.
Personally? Or did you send it the same way you sent to the AG? How did you get it?
I had to get piecemeal documents from the various agencies. I'm not even sure I have it.
All right. Thank you. Mr. Fisher, please.
On that particular issue?
Yes, go ahead.
Our office, I know, served and got stamp received for each of those agencies. And Mr. Canto may be correct. We may not have served the Attorney General's office, but the other three agencies were served, and I know you just asked if they were personally served in their individual capacities. They were not.
Was their office served or their attorneys?
We are unaware of who those attorneys might be, other than I can't pronounce the gentleman's name up at Adelaide, Mr. A.
I don't know.
I don't know either. I think that we filed all those documents with central files.
All right. In an abundance of caution, being that they're not here today and not knowing actually who's going to be representing the Nagahaga, the court is also concerned that GPD has its own attorney. They're not here today, and you're telling me that they were served. You see, Mr. Byrne is also a defendant. We do not know if this attorney is going to be present. Mike, you know, are you representing all the three four defendants?
Yes, Your Honor. I connected with appearance today, but we got notification, given the notice of hearing that was said ex parte on it, that all the individuals named as defendants were required to be present today, Your Honor.
All right. May I ask, though, you would again be representing all four entities?
Yes, Your Honor.
All right. Would you be ready for it if the court were to give you a hearing date by Friday at 2 o'clock? Would you be prepared?
Yes, Your Honor.
Mr. Fisher, in light of the information received, the court's going to continue this to Friday the 29th at 2 o'clock to give the government. Mr. Canto would just advise the court that he is representing the Nagahaga. He is representing Captain Ignacio and representing Byrne from the Department of Administration. And in an abundance of caution and the way things were happening, let's give them that opportunity so they can respond for all of his clients. Would that be acceptable?
Yes, Your Honor, but I would like, if I may, to make the government of Guam's position, probably all the respondents' positions clear, that we would like the opportunity to be able to inform the court as to how the vehicle of writ of mandamus is inappropriate before the court were to decide whether to issue it or not. And that, I imagine, would require a briefing.
I'm sorry?
It would require a briefing. I'm sorry, it's difficult.
And this briefing, would it take a long time?
Well, Your Honor, the petition is rife with procedural infirmities. I think it will be somewhat extensive.
Your Honor, we would like to get in light of the facts here. For example, Mr. Tapasnia cannot be here Friday. We'll waive his appearance because he has to go to work. And we're still in the course of a public emergency. Today is Tuesday. If they could get the briefing done by close of business Thursday, then we can perhaps move forward.
Would that be acceptable?
Probably, Your Honor. I would note that there is no sense of exigency here. There's no urgency. We're talking about wages, which...
We are in an exigent circumstances until the governor of the Nagahaga calls us into I wanted to, of Court 4, but it isn't Court 4, it's P4, correct? And we're not there yet. And from what I understand, in looking at this courtroom, sir, it's still an emergency because you cannot allow more than 10 people to be in here, all right? So I understand your position, but can we come back here on the 29th at 2, with your office filing before 5 o'clock on the 28th, your position regarding this petition for the writ?
Certainly, Your Honor, and just to clarify, I did not mean we're not in a public health emergency. I just meant that the issue itself is not exigent because it just means wages that we continue to accrue if in fact they are proved to be paid or should be paid in the future.
I understand. Okay.
We'll be ready.
Mr. Fisher?
Yes, Your Honor. Thank you. I would just say that that is not petitioner's position at all.
I understand. I understand that we are in a condition of 2. We have not moved to 3. We're still in a state where we cannot have more than 10 people gathering together in a group. And I understand your position, though, Mr. Canto, noting that there are 4 levels of this Corvette situation. Now, it's going to see you back here Friday, 29th at 2. AG, you have an opportunity to file your opposition on the 28th, and if you're going to file any reply, it better be done before 2 o'clock on the 29th.
Understood, Your Honor. And just, we'll serve the Attorney General's office this afternoon again. To make sure that they're content, that they get.
Attorney Fisher says they now have over 100 essential employees supporting the case, and this includes representatives from the AG's office. The AG's office, after the hearing, provided the following statements. Quote, while we have repeatedly expressed our support for the compensation of essential employees during these extraordinary times and want to resolve this matter as soon as possible, there is still a process that must be followed. GovGuam employees have a right to participate in this process, and we respect that right even when exercised by one of our own employees. The court ordered Attorney Canto to file a response by Thursday, and a continuance was scheduled for Friday at 2 o'clock in the afternoon. Over 600 essential employees are on board with the Guam Federation of Teachers to sue the government over the double pay matter. According to GFT Representative Robert Koss, the union has obtained 605 consent letters they plan to turn over to their attorneys to file a class action lawsuit in the District Court of Guam. Of the hundreds of employees, 10 individuals were selected or will be selected to represent the class. The union is suing the government for allegedly failing to pay first responders and frontline workers the mandated double pay in response to the COVID-19 pandemic. The Archdiocese of Agana's Chancery office reopens today after being closed for 9 weeks because of COVID. The Chancery will continue to follow a 3-day work week with the following hours of operation: Mondays, Wednesdays, and Fridays from 8 a.m. to 4 o'clock in the afternoon. Meanwhile, the Archdiocese this Friday will be closing its 24-hour information helpline for matters pertaining to the virus. The Archdiocese had established a national toll-free number in March to help Guam Catholics with questions about church matters related to COVID-19 following the temporary suspension of public masses, closures of parish offices, and schools. The COVID-19 helpline is different from the Archdiocese Victims Assistance Hotline. That number is 562-0039. That hotline remains open Monday through Friday from 8 o'clock to 4 p.m. in the afternoon. In news from the CNMI, we now check in with our Tomas Manglotnya, who is on the line. Tomas.
Good morning, Bree and Chris. Here's the latest in the Northern Marianas. As reported yesterday, some encouraging news for the CNMI. The Northern Marianas now moves to open churches, dine-in restaurants at limited capacity, along with other operations. Some residents and some of our viewers expressed concern. Here's a clip from a media briefing yesterday as Esther Muña, the CEO of the Hospital of the Saipan CEO, addresses those concerns. Take a listen.
Good morning.
I just wanted to ask the panel today, what's the message to those in the community who might say, this is too fast? What's your reassurance to those residents?
As it's actually not too fast. I mean, I think it's not a light switch, as Dr. Frieden had mentioned this, as we start to lift some of the restrictions, it's using a dimming light, right? Slowly opening it up and looking at some of the restrictions that were placed since the first case we had, and Now we're putting in the restrictions. There are still restrictions. Let me just be let's be mindful about that. The restrictions are still there. It's just that it allows, number one, we've seen what the community has done. The business establishments have already been, putting some of their own restrictions in their facilities. So, the message is always, again, I hate to keep repeating myself, but I am going to repeat myself. The message has always been about, keeping a distance, 6 feet apart, washing your hands, putting a mask on, protecting me, protecting you. So those messages are still there. It's definitely doesn't say that. That's one of the things that I want to emphasize is that, when we went over this, and this is a group effort from CHCC to look at the restrictions that was already placed and see which ones can be lifted. It took a lot of thinking about this, and what can we do, and how can we ensure the public that they are safe. And a lot of it is also monitoring and checking and making sure that there's actually penalties there. That was thank you, Governor, for putting those there. But those are they're penalties if you don't follow that. So those restrictions are there for a reason. Again, it can always be taken back, and that's the thing about it. We're not doing it at phase 1, phase 2. It's basically it's like a green light, right? I mean, it's like a dimming process, and you basically lower it. If you need to have if you have to go back to red, then if that's what's going to happen, then we're going to have to go back to more stricter directives. So it's this is not it, saying this is it and that's what we're going to do. It depends on the testing. It's calculated with the amount of testing and amount of negative results, and also looking at the geographic where this the positive cases are at, and how are they at, are they prevalent in one? Is it just a cluster, or is it community widespread? So those are the things that I just wanted to emphasize.
And another update on the testing front, the Solgen test kits being used in the Northern Marianas are now listed on the FDA's website as approved for emergency use authorization. The 60,000 test kits which CNMI Governor Ralph Torres acquired were cause for some controversy in the region, as Guam Governor Lou Leon Guerrero said it was a dead issue after media pressed her on the matter for use on island at a prior press briefing. The FDA's website indicates that the EUA for the test kits was issued on May 21st. In a letter signed by FDA chief scientist, she partially writes that based on the totality of scientific evidence available to the FDA, it is reasonable to believe that the product may be effective in diagnosing COVID-19, and the known potential benefits of the product when used for diagnosing coronavirus outweigh the known and potential risks of the product. And in other news, there remains 22 cases of cumulative number of confirmed COVID-19 cases in the CNMI. The number of persons released from quarantine is at 452. The cumulative number of recoveries is 13. The number of deaths remains at 2. And an update from yesterday from the community-based testing initiative throughout the Marianas, Saipan has tested now 4,466 residents. Kenyon has tested 192 residents, and Rhoda has tested 282 residents. Bree and Chris, that's the latest making news here in the CNMI.
Thank you, Tomas. In national news, the World Health Organization says countries that open up too fast could face immediate upticks of illness and death. The warning follows the Memorial Day weekend in the U.S. mainland, where the death toll is approaching 100,000. Still, millions ventured out, and many did not follow social distancing guidelines. Tom Hansen has the latest from New York.
This crowded pool party at the Lake of the Ozarks over the weekend prompted health officials in Missouri to issue a travel advisory. If you are at the pool, you must self-quarantine for 2 weeks. The unofficial start of summer coincided with relaxed restrictions in all 50 states. After months of sheltering in place, many Americans who ventured out weren't sure what they'd find.
Traffic has been backed up on both sides, and the beach has been packed.
They try to go to different places to see where it's less crowded.
Today, the World Health Organization issued a reminder that the number of virus cases can jump at any time.
We may get a second peak in this wave.
On Sunday, 25 states reported increases in their average new COVID-19 cases compared to 2 weeks ago. 3 of them, Montana, Alaska, and Arkansas, up more than 100%. In California, 150 food processing workers have tested positive for the virus at 9 LA area plants. On Sunday, Minnesota saw its largest single-day increase in the number of COVID patients needing ICU beds. And in Montgomery County, Alabama, the number of cases has doubled in the past 2 weeks.
20 to 25% of the hospital is either filled with patients who are positive or who are suspicious and positive. The ICU beds are essentially totally full.
Here in New York City, the stock exchange opened today after more than 2 months of all electronic trading. Only about a quarter of the staff was allowed back. As New York's Governor Andrew Cuomo rang the opening bell, the Dow surged more than 600 points, with traders optimistic about a vaccine. Travel, entertainment, and retail stocks made early gains, but what is normally a scene of controlled chaos was more subdued under new pandemic rules that include social distancing and masks. Tom Hansen, CBS News, New York.
Nevada's governor is expected to announce when and how Las Vegas casinos will reopen later today. In your Banking 671 report, the Guam Bankers Association is encouraging residents who plan to file for Pandemic Unemployment Assistance, or PUA, to consider opting for direct deposit. To opt in, you're urged to take the following steps. 1, open a deposit account with your preferred bank, collect necessary account information, be prepared to provide your account number and routing number, and visit GDOL's website, their online portal, hireguam.com, to apply for assistance, again, once they begin to actually accept applications online. And that is your Banking 671 report, brought to you by the Bank of Guam and Coast 360. Christopher.
Thank you so much, Sabrina. Again, as I'm sure you guys know, we started the show with the announcement they're not accepting any more vehicles for the GDOE food commodities. 642, good morning. Let's go to the phones here, where we have from the Salvation Army, and kind of keeping with the theme this week, they're out there testing the homeless, Sabrina?
Yes, they are. I think they're in Paseo today, I believe.
Yeah, and so I want to bring from the Salvation Army Major Tom onto the show. Good morning, Major.
Good morning, Chris. Good morning, Sabrina.
Good morning.
I guess, first of all, were you guys involved with the food distribution this morning?
No, not with the GDOE. They're in our backyard, but no, we didn't help with that. But we were glad that that food's going out to them.
Right, and so I don't know if you heard the news, but before the commodities distribution even opened, they shut it down because there were 2,000 cars already, and I guess they had there's only 2,000 bags, so a lot of people got turned away this morning.
Yeah, well, I'm getting those reports now, and I know that we were kind of concerned about the location in Tejan where everything is, because there's only one way in and one way out, and it gets quite congested, especially when the high school's in session, and so that area gets congested pretty quickly, and so we had some concerns about that, but we hope that they will able to work out their logistics to get that a smoother transition, to get people in and out of that, to get their food.
Kind of curious, Major Tom, because we haven't talked to you in a few weeks, and since the last time we spoke, the stimulus checks have hit the island. But, the feeling I'm getting is that doesn't mean everyone's okay now. I'm not sure what it translates to on your end as far as, like, assistance that you guys are giving out goes. So could you just tell us what's it been like with Salvation Army for the last 2-3 weeks?
Yeah, well, this is going in our 8th week of the COVID pandemic response. And the Salvation Army, we're firing as many cylinders right now as we can. We're still staying consistent with our appointments. Last week, the week of 18th through the 22nd, saw 113 individuals, which translates to about 430 people assisted out of those family groups. So we're still seeing about 20 to 25, 30 appointments a day, and 113 of those, Chris, of that number I just shared, are still new clients to the Salvation Army, which means these are new COVID-19 people who have been affected by COVID-19 by loss of hours or lost their job, furloughed, whatever it might be.
Yeah, there's still no assistance for them because we're trying to figure out this unemployment.
Yeah, I think that right now, I mean, the stimulus may have been a nice comfort for the moment kind of thing. But I know some people are worried that their bills are stacking up, their rent's stacking up, even though they haven't had to pay for a couple months. There's just a lot of concern, I think, financially for people. Food is always a good thing to help people out, but I think people long term, once we get into July and August, people are really going to be looking for assistance for maybe some rental assistance and some other kind of thing to help them to catch up where our bills have kind of been laying low for a minute, and it's going to catch up eventually.
Well, I know the bank is calling.
Yes, yeah, for sure.
No laughing matter, but you're right, and I think that stimulus for some people was a comfort. For others, it was just like they were at such a deficit from spending on food, from staying home, to obviously being out of work or having their hours affected, and now we're kind of in this desert where we heard from the labor director yesterday that the application, he wants to have it out by this week, but then he's saying that after you turn in that application, he's anticipating a 3-week turnaround from turning into the application to issuing of the check. So we're, hung out to dry. Yeah, I don't know if it's anybody's fault necessarily, but yeah, that's the reality our people are looking at for the next month.
Yeah, and I know a lot of people are talking about, I've heard a lot of things about the retroactive payment, but if people still have a lot of their bills stacking up, that's going to go pretty quick, and the high cost of living in Guam, it's going to catch up rapidly, and people are still going to find themselves in debt versus coming out ahead. At least that's what I'm forecasting. I could be wrong. I hope I'm wrong for the sake of those who are waiting on the money to come in. But as we're forecasting this, it looks like people will still be behind going into summer and even maybe into the fall.
Mm-hmm. Major Tom, I wanted to just ask about the Lighthouse Recovery Center.
Mm-hmm.
Is that still open, or has it reopened?
Yes, we've remained open. The Lighthouse Recovery Center, with our director Val and her team, have been open since we've never closed during the pandemic started. What we did is we limited the amount of intakes. We had a lot of souls in the building still, but now we're reopening little by little and working with those who can be intaked into the program to be COVID tested. They may have to be quarantined when they come into the building, just to keep the house safe, because in shelters, even the common cold spreads pretty quickly. But our team has remained constant. They're doing telemedding with some of their outpatient services, and this way they're still getting their counseling in with their clients. So the Lighthouse is still open and still, and now we're trying to get back to that place where we're having more people come in for their drug testing, and also for the beds being reopened for rehabilitation.
Are you seeing an increased need to provide services on that end?
Well, I would think that our director Val would be able to answer that more with more stats, but I would think that during this time, I'm sure that those who would seek rehabilitation may have not and stayed out on their addiction because there was no opportunity. But we hope that that's not the case. But again, we see the realities of what pandemic can do when it concerns people. Still, are caught up in their addiction or whatever that is, and so we're hoping that as we come out of this, that these services will be once again reopened and engaging with those people to come in and find treatment, and also to just start their lives over again, free from addiction. Mm-hmm. And the Lighthouse Recovery Center has been open for several, over 20 years already, and they've saved so many lives from their drug addiction. And so I think that the Lighthouse is really, that's what it is. It's a lighthouse for people finding a new life for themselves. And we're excited for the future of the Lighthouse as it reopens and re-engages with that community.
Yeah, I asked that because there was this really disturbing story that we posted last night or yesterday about some children who were found in poor living conditions, and they were like ages 6, 3, 2, and 1, and it seemed that drugs may have been involved, and so
right. Yeah, this is. I know we've seen reports of domestic violence on the rise and different things like that. People being furloughed or being quarantined, and so there's a lot of concerns that we're going to learn out of this when we're talking about meeting some social needs in our community and even stateside with drug abuse and domestic violence, those kind of things that will most likely come to light and to the surface of things as we're coming through this period.
Mm-hmm. Well, again, thanks for at least doing what you guys can, helping people with the food and also with their addictions.
Well, during Mother's Day, I have a kind of a positive, great story. Hopefully, you'll enjoy this. Is that we had received a donation from DFS of Godiva chocolate that was sitting in a warehouse that was destined for our tourists, but since that isn't happening, they wanted to put it out for use. So we had a couple pallets, and we got it right before Mother's Day. And so for during that week, as individuals, especially moms, we had Salvation Army cards made up, handwritten notes saying Happy Mother's Day, and we were giving box of chocolates to moms because some of them have been isolated from their families, and we were able to give chocolates. They didn't expect it, and it was a kind of a unexpected gift to them, and their faces just were expressions were, oh, this is great. They're tearing out how great it was to be honored on Mother's Day. And then we got a call to do a grocery delivery for a senior in Tumon, and we brought her food and her cases of water, and we surprised her with, and she was a grandma or whatever. You could tell that she was already grateful for the food we brought, and then when we gave her her box of chocolates, she was tearing up. It was such an emotional time, but these are the kind of things when you're doing social services like this, and we talk about numbers of how many people we're assisting, but it's really about the impact of someone extending an arm of compassion during an uncertain time. And we're grateful for that donation and all the other donations we've received, from the bottled water to canned food drives and all those kind of things. But every little bit helps make people a little more comfortable during this time. And so I just share those stories because there's a lot of negativity sometimes, and but we've seen some great things, and those are the kind of stories that make us push on. That even in the darkest times, they're still good, and God is still good. So.
Well, thank you for sharing that story. And you're right; it kind of does help you keep going. I know it helps me because there's so much things that we're trying to keep track of, and that we are tracking. And sometimes it's not always good news.
Right. Yeah. Major Tom. So I know that you had told me in passing that you're actually your time here is running out. So what can you tell us about that? When are you leaving, and where are you going, and who's going to replace you?
Well, the Salvation Army runs paramilitary, and 4 years ago we got the call to come to Guam from the States, and we left our daughter and granddaughter and our family behind, and we embraced a new family here in Guam. And Jason Salas has officially said we're Guamanians, so I'm going to take that title. So I wear that badge just proudly. So we leave Guam as Guamanians back to the States. We're appointed as officers and command and area leaders in Boise, Idaho, which means I'm going to have to buy a jacket now. But we leave at the end of June, probably the week of the 22nd. And then there'll be new officers coming from the states. They're great officers, captains. They're on their way. Carrie and Eric Rudd. They'll be here, and they're excited about embracing Guam as well, and carrying on the great work that the Salvation Army is doing. And so for us, we're just, we're going to be hitting the gas till the day we have to get on a plane here, because the work here is important. And even with this outreach we're doing with the Homeless Coalition, our Salvation Army team has been out there. We were out there yesterday. Guam Post were kind of tailing us with some of our homeless folks that we were doing testing for. So even though we're on the move and packing and in between of all that, we still love Guam and want the best for those we're serving. And for you guys too. You've been great. KUAM has been a great partner to the Salvation Army and getting the word out of our work and our mission. So we've been really great to have that partnership with you.
Well, we're certainly going to miss you guys. Best of luck to you guys and safe travels. But the Rudds are really going to have some big shoes to fill.
Yeah, that's for sure. I mean, what are you, like a size 20? You got them Ronald McDonald shoes. That's how big shoes they got to fill.
But please let them know, we're still willing to partner with them when they come on board.
For sure. We're looking forward to that. And they'll set up a time to either do an interview or a call-in like this to say, here we are, and that kind of thing. So, but we're, it's always hard to say goodbye, especially in an island like this. You become family very quickly. And we have a great staff at the Salvation Army who are always willing to do what it takes to help others. And so we leave the Rudds in good hands. And so we're excited about the future for them and for what the Salvation Army lies ahead. We have the women's, if you remember, the Lighthouse Women's Center going to be built there in Teton this year, hopefully in partnership with GURA, that once everything kind of, whatever that new normal looks like, that we can have a crew come in and start building that, to have a new facility for women to seek treatment. And, of course, our food pantry is going to continue to put out. And so I think that the future is bright for what the Salvation Army offers on island.
Well, Major Tom, I just guess in closing, seeing as how there's a significant amount of people who are turned away today, are you guys offering any services, and then what number do they call to make an appointment and avail of that?
Well, they could still call our number at 477-9588.
All right.
To set an appointment.
Okay. And that's social, Salvation Army, they've been setting the appointments because of the social distancing and kind of like control the flow of traffic into the facility, right, Major?
That's correct.
All right. Well, thank you so much. And hey, you got a month left. Don't be a stranger. Let's go out with a bang. I mean, you are banging it out there, man. You're bringing it. Appreciate it.
All right. Thank you,
right.
and we'll be in touch again.
Okay, Major.
Be safe.
All right. God bless.
All right. You too.
Bye.
Wash your hands. 6:58. Yeah. Wow. Been a good run with Major Tom. Rough year for these guys, though. I remember responding to when their store was broken into. It was just a few months ago. What a bum deal, man. They had they got these security systems, ironically, donated, and they were stolen. You know what I mean? So it is what it is. Major Tom, that doesn't change his vibe at all. He's still out here trying to do things. But obviously he had a good run here in the last 4 years, and I'm very thankful and appreciative of the work he's been able to do. And, he sends us these charts, Bree, and they kind of like break down the aid that they've given out. And if you look at it, I mean, for every disaster, I mean, even the federal government shutdown, they've been providing, food assistance to people, and it's been consistent. So,
and you can always count on the Salvation Army to be there in our times of greatest need.
Right, and 6:59 now. We're KUAM FM in Agatna, Guam. Let's go to the phones where we're going to check in with the Guam Election Commission's Maria Pangilinan, because there is an election. Can you believe that there's an election going on this weekend, Miss Maria?
Yes, there is, all the way up in Jotnia. The 2020 Jotnia special election for mayor will be held on Saturday, May 30th, from 7 o'clock in the morning to 8 o'clock in the evening.
Mm-hmm. And what, is there 4 candidates?
6, ma'am.
6? Whoa. A lot of people.
Yeah, so there will be, we went around the village last Saturday with the mayor's loudspeaker announcing the election. We have our big signs are out. They were put up by the mayor's office yesterday, and we have a mailer out. So we'd like to invite all the registered voters of Jotnia to come out on Saturday to make sure your voices are heard and vote for your mayor. We also are conducting homebound voting services right now. Call our office from 8 o'clock to 5 o'clock up until Saturday at 4 o'clock. If you're home and you're not allowed to go outside because you are ill, please call our office so we can see if we can service you. In office voting with excuse. If you're going to be off island on Saturday, if you cannot make it to the polls from 7 o'clock to 8 o'clock, you're welcome to come into our office, fill out an affidavit that will be notarized that says that you're not able to come to the MU Lujan to vote, and you can vote in our office from 8 o'clock to 5 o'clock. Our office is temporarily located downstairs of the GCIC arcade building. Mm-hmm. Also, there will be curbside service on Saturday. If you're not comfortable about going into the polling place, there will be curbside services. We will be outside to bring your ID in. You know, we don't know what to expect with curbside.
Right.
But, please note that the Guam Election Commission is doing everything to protect the registered voters of Jotnia and the community of Jotnia. We will have hand sanitizing equipment outside. Hand washing equipment outside. We will have hand sanitizers. We are asking the Jotnia voters to bring to make sure you wear your mask, to try to bring your blue or black pen, and please note that we will not turn anybody away.
Hey, Ms. Maria, sorry. So you said that homebound voting for those who are ill. What about those who don't want to risk getting ill by venturing out?
The only thing I can say at this point is the law is very clear that you are ill. If you are ill, then if you're sick, then that's what the law says, and that's what the Guam Election Commission has to stand by. Mm-hmm. So if you're just scared,
don't be scared. People from Jotnia are not supposed to be scared.
And so, and we're doing what we can. Our precinct officials will be wearing face shields. They will be wearing masks. We've trained them to make sure they wash their hands consistently while they're there. And the Guam Legal Services helped us train them also, especially for the persons with disabilities. So please come out and vote if you're registered to vote. 2,890, almost 2,900 voters are registered in Jotnia.
Okay, so this Saturday, 7 to 8 p.m., MU Lujan Elementary School, and so what, by midnight, maybe we'll know who's the new mayor?
Thank you, Sabrina. I think that's
Is that generous, Ms. Maria? Because we don't want to really be staying up till midnight.
Chris. Yeah, I don't know, Chris. And yesterday someone visited our office downstairs, and they were telling us that they're going to start a write-in campaign for the special election for Jotnia. So we'll see what happens.
Oh, God. Oh. What happened with the ballot, Ms. Maria, on the number 2?
Yeah.
Oh, thank you.
Yeah.
Thank you for asking.
Is that going to present any issues with people?
No.
Maybe someone is a sore loser, they want to challenge it because the ballot.
We consulted our legal counsel.
Okay.
With that, what happened was because of COVID, one of our candidates pulled out. She gave us her official notice. We brought it up to the board and our legal counsel, of course, and because everybody already drew their slots and their numbers for the election for the ballot. So the Guam Election Commission opted to leave number 2 in, take away the name, and take away the oval. So that would minimize everything else with regard to the other candidates as well.
Okay.
All right. Glad we cleared that up, Miss Maria. So, again, people go vote. You guys got the rest covered, whether it's curbside or sanitizing. You got the hand washing station.
And we have the social distancing. We'll mark off. And the Junior voters. Okay, be prepared. We will have staff out there taking your temperature, asking you a few questions about how you feel today, making sure that if you have any symptoms, we will ask you to go to your car and we will service you on the car. We will not turn anyone away.
Are is your staff going to be fully with like the full-on PPEs, the hazmat suit and all that, and the face shield, or is it just going to be mask and gloves?
We will be outside in fresh, clean, open air. So most of them will be wearing masks, face shields. Some of them will be wearing gloves. And we will sanitize the pens as we go along. We have sheet protectors for the sign-in sheets for curbside voting. So even that will be protected and will be sanitized after every voter has signed.
All right. Well, good luck.
Oh, thank you. We need it, and we need the support of the Jotnia residents also to come out and show that we are still alive and we are still trying to work with the public health emergency.
Miss Maria, any update on the regular election that's coming up?
I just looked at our website again. We are still accepting candidate packets. One more person filed for candidacy yesterday, and so if
for which race?
For I believe mayor of Jigo.
Okay.
So we still have only one person filing for candidacy for senator. Everyone else is a mayor or vice mayoral candidate.
What about the congressional?
No one yet. People have inquired, and so we're looking forward to accepting packets for the congressional delegate, for senator, mayor, mayor, and vice mayor.
So people have picked up packets for congressional?
Since January.
Right.
Packets were made available since January, and so packets have, I think, two people have picked up packets for congressional delegates, I believe.
Senator Castro and then, of course, Delegate St. Nicholas, right? Those are the two?
I think so. And again, visit our website at gec.guam.gov. All that information is there.
It even lists who picked up packets?
Yes, ma'am.
Oh, let
Upgrade.
me go look.
Upgrade. What'd you do? You ask your grandkids to help you figure out?
Yes,
I'm just kidding.
actually, as you all know, we have excellent young GEC employees that keep me on my toes, and people say, "Oh, you're doing a fantastic job." It's the 13 of them. Thank you.
Well, there you go, and thank you guys. Be safe this weekend, Miss Maria, you and your staff.
Oh, and I want to do a shout out.
Okay.
The
shout out.
The Guam Police Department is really busy with COVID-19, and so in our discussions with the chief and the Guam Police Department, my shout out is to Superior Court Marshals. They will assist us in the election so that we can keep the Guam Police Department with the COVID-19 measures. So Superior Court Marshals will assist us and will keep the ballots secure during the 2020 Jonia special election.
All right, Miss Maria, thank you.
Thank you so much.
Does it matter if any of the marshals are from Jotnia?
No, because we can have them, Sabrina, we can have them vote. And
Was that the Joey Terlai hookup or what?
No. I mean...
Well, we don't have the names yet. We are training them tomorrow, so we'll find out. It shouldn't be a problem. Most of the time, they'll be outside the polling room.
I see. And so, Miss Maria, the sanctity of the process and the ballots, the transportation, have we sacrificed any of that because of the COVID and the new measures that we have to implement?
None at all. In our training with the precinct officials we've gone through, they recognize the sanctity of the ballot in that it's not like it's not like the $100 bill. So the processes remain intact. We've just had to add additional processes for disinfecting the room, the voting booth, and such. We're looking into when we were planning for the special election, we've had to think about, okay, how do we replicate this for the primary and general? And that's where we're at the Guam Election Commission.
All right. Well, thank you for checking in, Miss Maria. Wash your hands. Be safe, okay?
Jesus Maasi.
Okay, Algamas. 7-Eleven. Good morning. Let's keep it on the phones here and check in with our inside man on the Governor's Physicians Advisory Council, Dr. Hoa. Good morning, Doc.
Good morning, Doc. Good morning, Sabrina.
Oh, can you turn down the radio and speak up a little bit?
Okay, hold on 1 second.
I know you like hearing me loud. You're not the only one. I enjoy it, too.
Can you guys hear me now?
I can hear you.
Yeah.
Okay.
Okay, so Wednesday, we're just thinking, was there a Physicians Advisory group meeting last night?
We have a kind of short one, a middle one last night. So, and basically, we should be finalized and have a new travel guideline for our residents that return to Guam. So it should be at the governor's desk with the blessing of public health and everyone under the governor's advisory board last night. So I think we've come to a final conclusion of to put this plan on implementation sometime later this week or early next week.
Is this the recommendation you've been talking about returning Guam residents?
Yes.
Okay, so just so if people aren't aware, so the proposal was that returning Guam residents, if they were coming from the CNMI or the U.S. mainland, that they would be allowed to do home quarantine, and is that based on whether or not they received a test and it came up negative?
Yeah, this basically we have no test involved in here.
Okay.
Basically, what we do is that any returning resident, from the mainland, from U.S. and even from Japan and the Philippines that come in, is this our return resident? They have to sign a waiver form that the acknowledgement form that know that they will be home quarantined for the full 14 days. And at home, and if they're asymptomatic. If they're symptomatic, they will be quarantined and basically be tested for it. But for the full 14 days, they should be at home. The only place that they can go is the medical appointment. They need to be for emergency, but they should not be allowed to wander in the community for the full 14 days.
Okay, so again, you don't need to meet that requirement for that 72-hour negative test result. if you're
No.
returning?
Well, they don't need to, Sabrina. Just the reason is, number one, it's very hard to get the COVID testing in the state and in the other country. It costs a lot. It's not free, and you have to make an appointment, and the resort doesn't get back until 3, 4, 5 days later. So they're gonna miss that window, and it's really from the comment that we have from the return resident, it's almost impossible for anyone in the state to be tested.
Correct.
So we and it doesn't make sense if you're sitting in a plane full of people that probably don't have the test. So you're gonna be exposed anyway. So the logic thing is that just have them quarantine at home, and they have to sign a form. They acknowledge that, and then if any symptoms, they can come to a clinic or public health to be tested.
What do you think? How do you think the governor is going to react to this recommendation from her Physicians Advisory Council?
This is an effort between the Government Advisory Board and Public Health and CDC. So it's all on agreement. So the governor would like it. It's a lot less headache to deal with all the complaints we have so far on the hotel quarantine. Again, and so. The only one that we bear burden to cost is the people of Guam that when they return, if they deem that their house is not conducive for them to stay in there, but it's too crowded, then they stay at the hotel at their wish, and the government pays for it. But other people that are not from Guam, they the one that will pick up the bill and not go Guam.
Right. So
it's very friendly for our return residents, especially during the summer when the college kids coming home. It's a lot easier for them to be quarantined at home.
Doc, what would you say though to people who like the governor, because I think she's mentioned this in her press conferences, to people who say that this has been working and this is why we're in PCOR 2 is because we've been able to slam these people in the different quarantine facilities for 2 weeks, and we know they're there, we know they're not running all around the island. I mean, I'd get both sides, and I'm just curious what you would say to, because there are people who think of that.
Yeah, there's always people that are going to come in, and I think we have out of how many thousand do we have? I think we have like 9 or 10 cases that they pick up in the hotel, and those are people that become symptomatic, and they check because they're symptomatic. But people in a hotel doesn't mean that you're going to check on them with the testing. They only test if you become symptomatic. So you have coughing, congestion, or you have loss of taste, or abdominal pain. Those get identified, and then public health would test them. It's the same thing at home. When people know there's a long list of things there that if they have the symptoms, and that they will call, any clinic or public health to be tested. I think the people of Guam are very responsible. That's how we get to where we are. People does listen. They do stay home. The majority of them stay home, and they don't go nowhere. When the declare emergency, and the governor asked them to stay home. So we are not where we are unless the people, everyone on this island, follow the rule. And I think the 99.9% of the time they are following the rule. So that's what the system that in place in every country around here, Taiwan, Korea, Japan, they all do the same thing. At first we have to be very strict to use at hotel quarantine to close the gate. But I think that now that we know much more about it, we need to kind of relax and let our people come home.
But you guys have been talking about this, and I think you presented it to the Physicians Advisory Group, presented this to the governor 3 weeks ago, and yet we have been waiting for her to make a final decision. Do you know what has been the holdup?
So it's not a holdup, Sabrina. I mean, it's a major change from our current policy, and it really needs to be thoroughly discussed within the advisory board, public health, and CDC. We have to. And it's not, it's not all we wanted, but we get the base one. We pass something, and as things improve, we continue to modify this thing. But at least at first now, that number one, that we get our people home, for quarantine, and number two is we kind of come to a conclusion that, hey, if they are home in quarantine, we're not going to test them if they're asymptomatic, and if they have symptoms, they come in. So it's a lot of talk back and forth, and it's not the governor. It's just the three bodies just have to sit down and kind of harsh everything out in order to put this thing in place. So I think we're comfortable where we are. So again, yesterday probably the final meeting for that one, and sugar up to the governor sometime this week.
All right.
What can you?
Now, I wanted to ask, since we are on the subject of quarantine facilities, have you heard what was the reason for more than 60 passengers to be moved from Hotel Santa Fe to another government quarantine facility at the Ocean View Garden Residence?
I think every place that our residents stay should be somewhat up to certain standard. If they're not a certain standard, then public health will ask them to be moved in the protection of the people that get quarantined there. So that's the reason why they get moved. I guess the room at Santa Fe is not adequate, so they have to move somewhere where it's more up to the standard for the people to get quarantined there.
Wow. So we went ahead and signed a contract for a hotel that was not meeting standards for quarantine.
That's something that I don't know what the policy and procedure is, but
I don't think anybody knows at this point.
Yeah.
Or is there one? I mean,
what I understand is that if they find out something that is not correct, it takes a lot to move people, but at least they will not leave people where they feel that it's not done correctly.
Correct.
So, whoever makes that decision.
Well, I understand there's like a walkthrough to check it out before signing on the dotted line.
Yeah. So
maybe it was a quick walkthrough. They're like, only walk in this part.
Walk through blindfolded. I mean, what the hell?
I mean, but I guess on the other side of it, Bree, is that we had Pacific Star, which clearly was inadequate from the pictures that we saw. Yet they continue to just ride that deal into the dirt.
Yeah, I think that as people stay where the hotel is, that they will find out more and more on the little detail that is up to standard and not up to standard once the people stay there,
Right, yeah.
So, but like I say, it takes from a big person to kind of make the decision to move, because they know they're going to get some criticism out of it, but they did move for the people, so that's a good point.
Right on. Doug?
Yeah, yes.
Are you good on the quarantine? Because I want to ask about the
the
payments for the Tier 2 clinics. We haven't followed up with you. I did get a FOIA of emails, and I know that when I had asked the governor about this in the press conference, she said that she said how I work is if I get an invoice, I pay it. And so I FOIA'd the emails between the governor's office and the Tier 2 clinic representatives, and I thought I saw an invoice in there, but it was just one. So can you tell us, because we're kind of going down the line, and we're going to get a doctor representing another group of clinics, or a clinic, tomorrow on the show, and find out where they're at with getting paid. So where are you guys at AMC in terms of getting paid? You guys were designated Tier 2 clinics by the governor.
Yeah, the AMC, FSP, and SDA, we move in one direction. So we would not turn anything in unless the two turn it in.
Okay.
We have to be fair to all three, because they all did the same thing and sacrificed a lot for those. So so far, I know physician-wise, we just work, but there's our admit side of the house. They are trying to work with the AG office and try to find out some type of contract in order for us to turn in what we should turn in. So so that side of the house is working on it. So far we have not turned in anything because we don't have any contract. per se. I'm not, I don't know the legality of it. We just want to do everything by the book. So
Well, I think if it's being paid with federal monies, right? You
right,
don't need one? Or what was that last week?
I don't know.
I'm not.
But
How come all of a sudden we need a contract? We didn't need a contract to pay anybody else, and now it's like, oh, now we need a contract, guys. Hold on. Oh, man, how much is the bill? Oh, yeah, we need a contract. Is that what it is, Doc? Are they just taking you guys for a ride? Because that's what it seems like.
Yeah, but, eventually we doing okay. And again, I think eventually whatever MOU or contract or whatever term will come out, but the admin of the house is there. And all the paperwork is in there, the AG office. And again, we put all our expense on the side, just like SNFHP, to categorize what we use.
Yeah, so actually, Doc, you're right. I just was going through this email. It wasn't an invoice that I saw. It was a recent summary of one of the clinic's expenses from March 17th to April 25th, which consists of $955,562.
That's
is that about what you guys have incurred too, Doc? $1 million?
I don't think it's that high. Our policy and our marching order is we just turn in the cost only with the expense and nothing else beyond that for any profit margin. So I think that's really, really high. So I don't think that is our invoice.
Can you just back this up? You said a marching order. Who gave you that marching order?
Dr. Akimoto and myself give a marching order for the admin side of the house because we want to let the admin side of the house know that we just turn in the expense that that we incur for the tier 2, but nothing else beyond that. So if it's a cost for me to pay my supply and my staff, that's all we're gonna turn in.
These tier 2 clinics, did you guys volunteer to be tier 2 clinics, or was this the governor flexing her public health authority powers and taking over the clinics?
Before she did the tier 2, the acute care, the care team, we have a discussion with the governor, and it's a two-sided agreement that we do that. We know that if we don't step up and do this thing, GMHER and GRMC more likely will not be where they are at this point. So we step up, and she agreed to basically determine that she's going to use the 3 clinics as a tier 2. So it's a mutual agreement between the two, and she don't want to exercise the take over the 2 clinics. It's an agreement between the 2 parties. So I wouldn't put that blame on her. It's we stepped up. We didn't know how long it's going to take. It thought it's about 2-3 weeks, but we didn't know it's going to last for several months. That's where it really go beyond our expense when we kind of burn off all our rainy days savings. So that's the thing.
Well, rainy season's coming, Doc.
A mutual verbal agreement.
Yeah, I would say that. I don't think that
an MVA
is something that I don't think the government wants to say that they take over somebody.
Right, but then wouldn't other clinics that maybe we wanted to help, wouldn't they feel left out, or would have been able to help?
Sabrina, Chris, at the beginning when of day one, I think in fairness to all the clinic, most of the clinic kind of shut down their service just because no one knows what's going on with this one. Nobody in the world knows. So we learn things every day. So as a bigger clinic, we have more manpower, and the structure of the clinic, we can isolate the patient in a certain way to let when the patient walks in, you're not going to infect everybody. As you can aware that if you have one clinic person, you have one waiting area.
Right. I mean, they just picked the 3 biggest clinics, basically, right? Doc?
Yeah, And basically, the 3 biggest clinics, the way they design, we can isolate the patient in certain area.
Because you got a lot of secret rooms.
Yes. So so we have a lot of the place that we have multiple entrance, multiple exits, so that way it's much safer environment for us to handle the patient.
We had a comment here, Doc, from Mary Jane. She writes, "The governor said, 'I'm taking over. I have the power.'" And of course, referencing that clip that we played last week with the governor speaking before the medical association.
Yeah, we know she say that, but I don't think in her heart that she actually will know that she will take over with no saying from you. No, they did ask.
Okay.
They asked before they took over.
Hey, can I take you over? And then give
Agree?
you a
You agree?
hard
You
time
agree?
about getting
Okay.
paid? Right on. Okay.
And like I say, at that time, with everything going on, we're gonna step up. AMC, SJ, SSP, they all step up. And like I say, when again, the administrator house are working on it. We don't know this is the first time ever in our history that we deal with this thing. So with anything else in the public regarding procurement, everything, we just want to do by the book. So we will not get criticized on this one. You got to do by the book.
You better be nice if you want to get paid now, Doc. I'm going to give you the floor. Do you want to say anything nice about the administration while they're listening?
I think everything is after the fact, but no, wrong or right, the people of Guam and this island are doing very well, compared to anywhere in the United States. I think that right now the only thing that we do is the governor will open out everything for our economy, get back with the tourism, and so we get our people back who have a job right now. So, we don't have that big curve like we project before, but like I say, that's because it takes all the effort people in Guam and getting where we are at this point.
Nice.
So I think that the people can be proud of themselves. The governors, I guess, everything else you read in the word is the same. The transparency things and everything needs to be in place for the people to understand more where all the funds are. And Guam is not unique. You can hear that anywhere else in the world too, in the United States. So I think there's a very big challenge for someone at the head. I don't think that any governor will be happy to sit in that seat at this point, just because it's so unique. The rest of your life, you will never see one like this again, I hope.
All right.
So,
Well, Doc, thank you. I don't know if that was really positive, but we'll take it. Duly noted. Duly noted. I'm going to send the broadcast over to Adelup.
Thank you, Chris.
Was there anything else that you guys discussed at the Physicians Advisory Group meeting last night?
We discussed a bit more about the tourism and how to get them back. We need to really start planning in the very near future to try to get them back. I know Governor Gutierrez out arriving a passenger board, and with his experience, we hope that he can work with Taiwan, Korea, and Japan to get the tourists to come in as soon as possible.
Mm-hmm. What about, was there any discussion on the dine-in services for restaurants and whether or not there's any movement to restore that?
We say open it.
Oh, you guys told the governor that?
Yeah. No, we told Mike Cruz to tell governor open it. So we can open it so we can go out and eat. So the restaurant have their own guideline already. They have very strict guidelines that protect the customer. So I think that as long as we are where we are right now with the number of counts every day, open it. So let's the economy start to get back, so the tourists know that, hey, it's safe to come to Guam.
All right.
Well, I'm sorry. One other thing, that the Public Health SIT report, I noticed something new on how they're pushing out the information, and now it indicates serology. So how long and when did we start doing a serology test? And just for our listeners and viewers, if you can explain just in layman's terms the difference between serology and the PCR test.
As this serology test is something kind of a little bit different because the patient presentation, the patient have multiple very severe chronic illness. and just like congestion heart failure, and when they come in complaining of shortness of breath, and the picture look like they have COVID on the X-ray and CT with presentation. It also correlates to congestion heart failure. So they go back and forth with the two, and when you treat the congestion heart failure, they feel better, and they go home, and then the congestion heart coming back. So the PCR test is negative. So they decide to run the serology test, and the serology is positive. It means that the patient might not have COVID at this point. It might have a long time ago that serology is positive. So the PCR is pick up the molecular or the part of the virus or the particle of the virus. Both of them are negative. So they run multiple tests. So more likely, in your mind, this patient is positive, but quite a way, several weeks back, that he had not seen anyone, and so they're going to count as positive because the serology, the antibody is positive. So you know that the guy had infection before, but he might not be infectious now, but he presents in a different way, like congestion heart failure. So as far as I can tell you without going anything else on this. So what happened is that the PCR testing is they pick up the particle or the virus itself. Okay, so when you have a person that is positive and symptomatic, and the PCR is positive, and after 14 days or 2 or 3 weeks, they don't have any symptom anymore. But if you retest them, it'd be positive again. Maybe because we not pick up the virus, or we pick up the particle in the virus, it's gone already. They're not infectious anymore. But we still pick them up because we pick up the pieces of the virus. Okay, so the antibodies, the serology, it basically your body form a protection from this virus, so it can pick up, either an acute, what we call an IgM, in that about 11, 10, 14 days after the infection, you pick that up to tell you that it's just a recent infection, and then the other one is the IgG, it's a chronic infection. That means that the person is no longer infectious anymore, but in the past sometime they are infectious. They have infection in the past.
Doc, what about we'd received a tip that a person who had COVID passed, but not from COVID. Do you know about this? What can you tell us about that? And then
what do you mean by pass?
Like passed away.
Yeah, died.
There's always, everyone that passed away will be tested for COVID. That's 100%. And so far,
I'm sorry, everybody that passed away?
Everyone that passed away, they will be tested for COVID-19. And so far as I know, there's no one that turned positive that passed away at home.
No. It's someone that recovered.
Someone that recovered
and was fine.
Was fine. That's a wonderful part. But someone could recover, is fine, and then they die.
Yeah, that's not considered a COVID case, right?
No, it's not considered a COVID case. If they if they remember, most of the people that is really positive, symptomatic, they have other complications, comorbidity for this. If you're a young person like yourself, it's very hard for you to pass away. And then look at all the 5 people that passed away. They're all elderly with multiple comorbidity.
Right.
So for instance, the people in your age group, they
the young people, right?
They're not going to pass away. Very rarely. So that's probably not the reason.
Okay, Doc. Okay. Thank you.
All right.
You're welcome.
Wash your hands, Doc.
I'm going to have to re-listen to what you said because I'm not sure I understood the difference.
You lost me at serology.
Okay.
I was like, no, not the serology question.
Just call me personally. I explain to you.
Right. Do you have any illustrations? Can we get Dr. McGlutton to maybe do like a nice chart?
Oh, we could do a flow sheet for
Yeah,
you.
make it easy, Doc. Okay, Doc, we gotta go.
Okay.
Wash your hands.
Take care.
Okay, see you.
Bye.
All right, 7:39. Dr. Hoa, always great to have him on the program. We're gonna take a really quick break, and then I want to bring in a woman who is basically asking questions about us reopening the island and telling people to go back to work, but not providing the opportunity for them to have childcare to do that. And this is something I keep hearing about from people who maybe for whatever reason they can go back to work.
Well, you remember early on, Dr. Felix Cabrera actually brought this issue up.
Right, yeah.
That there, if you have family members that can help, because they needed nurses to come into work and
Right.
healthcare professionals.
And the daycares have been closed.
Yeah.
So we're going to talk to a lady who's kind of, making some noise about it, and then talk to a daycare owner and find out where we are in terms of reopening that. I think it's essential. I mean, if we're going to tell people to go back to work and get back to normal, then we got to be able to provide that child care component in some way. At 7:40, so again, we'll take a quick break, and coming back with the KUAM News takeover of Guam's favorite containing COVID. Good morning.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
all graduating seniors. Join us by showing your class pride in the celebration caravan you deserve through the island's major thoroughfares. KUAM and its partners want to recognize your accomplishments and help celebrate this pivotal moment in your lives. To participate, email promotions@kuam.com and let's get this show on the road. Special thanks to ABC Stores Guam and The Dungeon.
Gotta let that one rock for a minute. And that no got Pago said, Guaiza Guahan. We're trying to come back stronger this morning and really just imploring the governor and the government of Guam to find a way to get more food out there for our people, as we're hearing. Not sure how many people were turned away, but it was a lot. And they were turned away before the distribution for the commodities even started, as they reached their limit of 2,000 food bags to be given out today. A couple questions on that is, what are we doing to give out more food? Because obviously the need is great if you look at the distribution of the commodities and the grab-and-go meals. So yeah, that's the question I would pose, is we're doing it again on Friday. How are we going to ensure that people who need food are not turned away when we're sitting on millions and millions upon millions of gajillions of dollars in CARES Act funds that could be used to provide food assistance, to provide mass feeding? So that's the call I'm putting out. Let's figure this out, guys. One Guam approach. I mean, I did see that we made improvements in the distribution by adding more sites, but I don't think that our elected leaders have truly grasped, and this is something sound like a broken record, been saying it since day one, they have not truly grasped the need that our people are in. And it's very easy to see if you get out here and look around. 749, and we talk about need as people start to go back to work and we inch towards normalcy. When people go back to work, a lot of people need childcare. And I want to bring on Dr. Jaylene Kent, she's a local business owner. Bree, she's also done a couple terms, I think, heading the Guam Women in Construction group. She's also a member of the Guam Women's Chamber.
Okay.
So good morning, Dr. Kent. Oh, wait, that's Lonnie. Okay, hold on. There you are, Dr. K. Good
Can
morning.
you hear me?
We can hear you.
Okay, gotcha. Okay, I guess first of all, we talked yesterday. Thanks for that. And you were a small business owner. You have employees who have come back to work, but what is it? You have a couple who just don't have the child care that they need to be able to return to the workforce for you?
Well, actually, we have been open. We're Coatings Roofing Supply. We're a construction supply company, so
Okay.
we have been one of the essential businesses. And we have our warehouse and procurement specialist who was able to work from home half-time and had child care. The daycare's closed, but he was able to find half-time someone to babysit his kids. And now as we slowly reopen things, he no longer has, his babysitter has gone back to work. And so he's now in a position where he has to be out of our shop, away from work all day long. And that can work for some of his duties, but you can't really drive a forklift from home or on Zoom, or, keep the warehouse or get products out to customers and such. So it became a topic of great interest to me on a couple of levels. I also have other women business owners, probably it's more women than men that wrestle with this, who have young ones, and it needs to be hand in glove, this idea of opening up the island with making child care available. And it's of concern to business owners on another level as well, which is we need to retain our employees for PPP funding. So I've found out there's a lot of good things going on here. In my efforts to help my own employee get resources, I've talked to Holly Rustick, who's the chairwoman of the president of the Women's Chamber, and she's on the Recovery Task Force. Talked to Jane Flores, who is very heavily involved in developing the guidelines that daycare centers need to present. And so it's being worked on in a quite serious way to get our daycares open, and it's complicated. But I'll just stop there because I'm sure there are other people who have things to say.
Right. No, and I did reach out to Holly this morning. I asked her if she could give us any update on any meetings that went down, and she had said yesterday she met with the Guam Women's Chamber Internal Committee, not in the governor's office. She writes, Chris, we don't have any updates yet, but we as a chamber have been receiving guidelines from our members who own daycares and are collecting them and sending them up for consideration. We've also heard from the Guam Child Care Association, who has sent guidelines, and we've been communicating with our members, so child care and daycares are preparing guidelines, so when they're able to open, they're ready. As far as hearing from the governor's office, I haven't heard back specifically yet, but I do know she's reviewing the data, so hopefully we'll hear something soon on the status. This is, of course, a very delicate topic. The guidelines set forth thus far are very gradual opening as specific precautions. But with the businesses overall opening, we feel like it's something that needs to be addressed. And, of course, we agree. That's why we have you here.
But were those guidelines sent to public health? I mean, the public health, I think, would have to be the one to approve them.
Yeah, I got Lonnie on hold here, and I'm gonna try and bring Lonnie on too, Doc, if you don't mind. We're gonna bring on Lonnie Tamandog of the Giving Tree.
I don't know much about the issue other than it severely impacts
course.
small businesses, and my employees are really desperate.
I mean, and Doc, you're not the only one. So we actually have Lonnie on the line now. Lonnie, what can you tell us about? And you own the Giving Tree. What can you tell us about the submission of guidelines for daycares and child care centers to reopen?
Hi, Chris. Good morning.
Morning.
Okay. Hello?
Yeah, we're here. Yeah.
Okay. So, well, right now, because childcare wasn't, we didn't see us anywhere in the pre-core phases of opening, and we kind of really didn't have any guidance early on what we needed to do to reopen. I know that myself and others in the Child Care Association have prepared our own guidelines for our own centers for reopening, and at the same time, the GCCDA, the Guam Child Care Development Association, has also came together and put some guidelines together to submit to the Department of Public Health so that we can maybe assist in them releasing the state guidelines for us to reopen. But right now, we don't really have much information. We're also just sending in emails, waiting for answers. We've reached out to different people. Of course, we've reached out to the governor. We've reached out to public health. We've reached out to some senators and assisting in the process. But as of now, we have our own guidelines to open, and the association has also put something together for them to look at and hopefully approve. We have many parents that are essential parents too that have been reaching out to us every day, trying to find out if we know anything new, and it's really unfortunate that we are kind of left in the dark. We don't have any information or new information to give them yet.
How long have you been working on your proposal, and how long have you been reaching out?
Okay, so we've worked on our proposal. As soon as we closed and this whole COVID, thing took over, probably a month later, we had already been told that we would have to have guidelines for reopening. So it's something that all the centers have been doing, working on our own guidelines for our own centers. And so we have our guidelines, and I know that there are many other centers that I've spoken to in the association that has theirs also. But we actually came together as an association to put a more general guidelines for all centers to open that we submitted to our licensing officer, who I guess will submit to the superiors and other Department of Public Health, and it has to go through an approval process, or they're going to review it and see if it's something, maybe if they're going to pull from there or add from there. We're not really sure, but we did just submit it. We just submitted the guidelines that we put together as an association, I believe, the day before yesterday or yesterday. Yeah.
So that's what Holly was talking about. Okay. Lonnie, give us an idea of
the guidelines. We did submit our own guidelines, which was asked for us to do, and we haven't heard back just yet.
Lonnie, are you sending them to the email address guam@littlegardeninter.com? The email address is Stephanie.
Okay, so Stephanie, she's the president of the GCCBA.
Right.
We don't necessarily need to send it to her.
Okay.
What we are doing is sending it directly to our licensing officer, childcare licensing officer. But we are working with Stephanie. We're all working together. We're part of a WhatsApp group chat, and we all speak to each other daily about what's going on. And what we did together is we kind of just pulled from our own guidelines, the CDC's guidelines, and put together a guideline that would fit for Guam. There are some things that, we have to change up just for how we run centers here on Guam specifically. So we did come together and put together guidelines, and I guess we submitted it to Guam Women's Chamber. We also submitted it directly to the governor, and we also submitted it to Department of Public Health and our licensing officer.
So Lonnie, you don't have any information as to when you may be given the green light to open?
So this is the $1 million question.
Like $2 million. It's like a $2 million question.
We have been asking, and it's not just about the opening. I know that we also were inquiring about the CARES fund because we have been closed 2 months already.
Right.
And this is really something. There are child cares that we need to even get back into our center just to clean, just to prepare for our guidelines that we put in place. But we're not allowed to. We can't even enter our centers. We were told that we can't even go in for sanitizing or cleaning, which is kind of difficult because for us to even, adhere to the new guidelines, we would need to rearrange furniture. We would need to start putting in more hygiene stations. There's just so much that needs to be done. And so it's a little frustrating because the association is just kind of sitting there like, okay, well, we have these guidelines, but who's going to help us out from here? We need to get back into our centers. And if we don't get back into our centers and if we don't speak to our parents about what's going on or the guidelines, imagine opening day when they finally say, okay, the green light's here, you can open the first week of June. Opening day is just going to be chaotic because we haven't had enough time to prepare. We didn't train our staff.
Right.
And, the staff needs to be trained on the new protocols that are going to be put in place. We have to change the way we do drop-offs, pickups. We have to change how many body checks or health checks we do on a day. We have to go over the procedures for our isolation, just everything. So we really want to get back into our childcare centers. Even if we're not opening yet, we do need the green light to go into our childcare centers, prepare our centers for reopening, and just go over the guidelines and training with our staff.
Lonnie, I want to go back to the CARES Act funds. Now there's is it 5 to 6 million, I believe?
It is 6.4 million, and they are continuing to pay for children that are under block grant, which is, I guess, part of the CARES Act funding, which is helpful, I guess, for centers that have block grant children or have majority block grant children. But then there are many centers that are not part of that program or don't have that many children. And so for those centers, there just really isn't any support or funding. And from my understanding, the CARES Act is also supposed to provide some funding for us to get our centers ready, get our PPE, do our sanitation, just prepare the center overall, and just to keep the centers afloat. I mean, childcare, I'm not sure how many people know this, but childcare is just notoriously known for its very small profit margins. So you can't imagine that here we are with all our staff, and some childcares didn't even get the PPP or haven't yet got the EIDL, and they're just, trying to be able to keep their staff on payroll so that they could support their families. But not all centers can do it. And so we need the extra support, we need the funding, we need guidance, we just need communication.
Right. Lonnie, guys, let me just break in real quick here. We're KUAM-FM, Hagatni, Guam. I want to say good morning to our TV 11 viewers who have just jumped onto the show. On the phone right now, we have Lonnie Tamandong, who's the owner of the Giving Tree, and also Dr. Jaylene Kent. And the topic is childcare. How soon is childcare going to be available for people returning to the workforce, and what do the child care centers have to do in terms of jumping through the hoops? Lonnie, I want to go back to the funding. You said that you had reached out to the governor's office. There is this impression that people have that they're just sitting on all this CARES Act funds, and I mean, with the internet, we all know what it could be used for, so I'm sure it's frustrating to know that there's $6 million that's earmarked for people in your line of work. What was the response that you got from the governor's office?
Okay, so yeah, it is. It's very frustrating, especially to know that it's been there for over a month, and we haven't even received any information from public health for what is going to be provided as relief for the childcare industry. Like I said earlier, at least a little guidance or communication would probably be best, and we probably wouldn't have made so much noise. But I know it's not just me and a few other centers, but we do know that the funding is there. We've reached out and we put out some letters, not just myself, but members of the association, the Child Care Association. They've even submitted a letter directly to the governor, Congressman Mike Nicholas, some senators. So everyone is pretty much aware that we are asking where the funding is, but we haven't received any response to any of our inquiries yet.
Wow.
Lonnie, are you working with the Recovery Task Force, the governor's guiding body, I guess it's called? Because I know Holly Rustic, I hope she calls in, by the way, the president of Women's Chamber. She's been very active on this issue, or Jane Flores. What about communications with those people who, in theory, are working very closely with the governor on this topic?
Well, I actually appreciate them. I am part of the Women's Chamber, so I speak with Eileen, and I did submit our own guidelines for the Giving Tree for Holly and Jane and those guys. So I know that they have been asking a lot of questions. They really want to support and get it out there. I know that.
Yeah, I mean, Lonnie and Dr. Kent, it's out there. Like, I mean, you should be able to write the governor a letter and not have to worry about it getting to whoever, and I'm saying, you guys are doing your part. It's all over the media. And really, when we go back to what I said yesterday about communications, how key is Adeloop's communications department in putting out this info? Mosqueda, like, hey, we got the money. We're trying to figure out how to get it out to you. But they didn't announce nothing.
Well, to me, it's a even larger issue. It's like common sense. Really? We're opening up the island and we haven't provided for our children. How did that misstep happen?
It's crazy because when I was looking at the P-Corps opening phases, and I was like, oh my gosh, there's no childcare here. I'm looking at all these industries going to go back, or the workforces are returning, and I'm pretty sure that there needs to be childcare for these children. So I'm thinking, oh, how are we going to get this economy going? There's no childcare available for anyone that's going back to work. And I think that it just wasn't even thought of, and I hate to say it, but I feel like childcare is always just kind of, put on the back. It's kind of forgotten.
It's weird. It's weird because how many people need it? I mean, how many
oversight, Lonnie? Really? You think it was just an oversight? I mean, it could be. I mean, it could be, but
I really think so. And it's kind of
have to be like a hand and glove relationship between opening businesses and making childcare.
Yeah, it's crazy because we have many parents that have been needing it. Even when we were first told to close, we have many essential parents. We have parents that are working in clinics, working in the hospitals, police department, fire department. We have children from all kinds of essential working parents, and they have been reaching out to us almost daily. Oh, is there anything new? And it's really hard for us because we're just saying that we're just waiting on more information from the governor and all these things. But everyone's being called back to work now, and they're all kind of just hanging there. And so I stopped charging a holding fee, which is what I used to, keep things running. But I can't continue to charge a holding fee when we don't have any information on when we can even open.
Right.
And I feel so bad for these parents. They need that money to go find a babysitter now, and it's just hard because I can't even get the information out there.
Right.
On
How
when
many
we can open.
how many childcare facilities are there, and just roughly just an estimate on how many children are seeking these services?
So we have, I believe, at least 43 centers out there.
Wow.
And so there are thousands. There are thousands of families that depend on the child care industry. And I'm not the only one that has parents asking. The whole association, we all share pretty much the same concerns. We're all caught up in the same thing. And even though this is really new for us, this whole COVID thing, even though we may feel a little scared, we're confident that given the proper guidelines and support, we're able to open and support these families and provide care for their children in the safest possible way that we can.
Yeah, Lonnie, that was going to actually be my next question, your message to the parents. And I guess, the governor's office of public health, you're confident that with these guidelines that you guys came up with and you put them in place, that you can watch people's kids and mitigate the risk of all the things that we're afraid of.
Well, I'd like to add something else in there, that a lot of the parents, so they've got their jobs back, but there's no daycare, so they have to pay a babysitter if they can find a babysitter. Well, a lot of these parents can afford babysitters. They were receiving child care for free on the block grant, and now they're finding themselves unable to afford child care babysitters, because they were getting their funding through the block grants for free daycare. So not only have they been out of work, many of them, now they have this unexpected expense of trying to get back to work to pay a babysitter. So it's really it's an important financial issue on many levels, and I know it's complicated from a health perspective, but we can do this. We need to find, I guess it's a political will, because I know that we can figure it out from a medical perspective and from a policy and procedure perspective. So I'm not sure what the holdup is, but gosh, we cannot open without daycares. Our people cannot come back to work without their children being taken care of.
I believe so, and the thing about it is, even if they were to find babysitters, it's going to be more stressful on parents returning to work, not knowing if their children are okay, not knowing if their children are comfortable. They know that their children have been in the child care center and they developed relationships with their caregivers, their teachers.
You bet. And not knowing whether or not the babysitter might be carrying the virus, right?
Or who has the health certificates, who has the training for first aid and CPR, all those things that come with them putting them in a licensed facility versus now they have to just kind of find or borrow time from someone else that isn't working that could take care of their children. It's just stressful on everybody. I'm pretty sure it'll be stressful on the kids. It's going to be stressful on the parents. Well, that's what we have now. We don't have any real opening guidelines or any information from the governor of when we can start looking into this.
Well, does the Community Development Block Grant, is that administered through public health?
Yes, it is.
It is, okay. And so I'm just curious, how does it work? So they, public health, they get the community development block grant money, and then they issue this assistance to those that are enrolled in the program to pay for daycare?
Yeah. So how it works is it's federal funds. The people that need assistance with childcare would apply, and of course they'd have to be working or going to school. They cannot apply and be under the program if they weren't.
I see.
And so they would look at their household income, and they would determine from there how much they're eligible for. So a parent can be paying 50% of the tuition or 20%, and some parents, they don't even pay anything. The whole amount is covered by block grant. During this whole COVID time where our centers are closed, CCDF has been covering 100% of the payments, meaning that no parent needs to pay any co-pays. They don't have to put any money out of their pocket, which is helpful, but it's also part of the CARES Act funding.
Right.
Our child care licensing officer is very supportive, and she tries her very best. I can see it. We can all see it. She tries to communicate with us all the time. She's just emailing us almost every day when this first started, and then it started turning into maybe every other day, every 2-3 days, only because there's just no more information that she can provide to us. And I know she's just waiting also on other people. She has no more information. There's only so much she can relate to us, and she has to just kind of wait on the governor's call when we can open. So I could feel her frustration too as the licensing officer for all the child care centers on Guam. We're all looking to her, but she has no new information. It has to come from the governor's call, I guess, and
Right.
because there's no guidelines, it's a frustrating situation, a hard situation for all of us.
And that's why we wanted to bring you guys on and kind of just, we've talked about this before, but really bring it to the forefront, because it really seems like a running downhill towards reopening. And that being said, obviously, I'm surprised at the oversight coming from a working mother governor that this wasn't part of the equation, when the discussions on reopening the economy started. But, it is what it is, and I'm pretty sure that I guess you guys have your point of contact on the recovery panel, and we'll just continue to push this issue and hopefully get some kind of resolution, ladies.
Well, thank you so much for putting it out there. This is astounding news to me to find out that this has not been moved, forward to the critical piece of opening the island.
Mm-hmm. So if you get the approval, let's say tomorrow, if the guidelines are approved, how long would it take to reopen?
Okay, so this is it. We have our own guidelines in place. We've submitted it to our licensing officer, but we have to get the approval for the, state guidelines for all centers to open. If we do get that approval, we need to know as soon as possible so that we can get back into our centers. Aside from it being approved, we just need the green light to just even enter our centers and start working.
Mm-hmm.
We need to start training our staff. We need to get our hygiene stations ready. We need to start preparing any social distancing accommodations regarding our furniture, just everything. We just need to prepare. So if we can just get the go-ahead to even go into our centers, we're not working, we're not opening, but we need to be able to start working with our staff.
Lonnie, I'm curious, sorry to interrupt you, but why are you unable to enter your facility?
Yeah.
We're all curious. So we were just told that we weren't able to, and this is something that we actually had Stephanie, the president of the Child Care Development Association, reach out to DEH just to get some clarification on why we are not allowed to do that, because can you imagine if, mold builds up? It's just been 2 months and we're not able to get into our center. It's crazy.
Who gave you that guidance that you're unable to enter your facility? I haven't heard anything like that on the
Division of Environmental Health.
Okay. And what was the reasoning, Lonnie?
Yeah, what was their reason?
They just said that we're not allowed to even go into our centers, not even sanitize. The question straight out was, can we at least go into our centers to clean and sanitize? You know what? I own my centers, I own my buildings and everything, and it's just taking care of the building is something we do all the time. So I've been going, but we cannot have staff come in, which is the biggest issue, because we need the staff there to go over. They're the ones with the children every day. It's not us owners. they're the ones who know what they can implement, how it's going to work, and they're the ones that need the dry runs or need the training. They're the ones who need to put their furnitures around and make it so that it's going to work once they come in. So we just need to get into the childcare. If we can get into the childcare, then that takes a lot of stress off of our agenda.
Right. Okay, so we're going to put it out there. Show us the money. Where's the CARES Act funding for the child care centers? And also read the guidelines, and let's have this conversation about...
So the CARES Act's another thing, because I actually had Senator Amanda Shelton reach out to me. I guess she saw the whole open letter to the governor. And she said that she had spoken to them, and they said it's going to take another month before applications are available for these grants.
Oh my goodness.
Which I find crazy, because CCDF is already an existing agency. All they did is add money to it. So I don't understand why it takes so long. I mean, the word relief doesn't become relief anymore. It's more like disbelief, like we need to relief now. And it's like, how is this going on this long? And how is it that our industry, which I believe is very essential.
It's essential, yeah.
Yeah, it's just kind of forgotten or put on the back, and we're just not being heard, and that's the reason why.
Well, you're being heard now, so thank you.
Did Senator Shelton say why it's going to take a month? Nothing's been written up, or I don't get it.
She got into it. She reached out to me, I guess, because of all the information I was putting out there on Facebook.
Right.
And she told me that, I'm gonna get to the bottom of this. I'm gonna find out information for you. I'm gonna try to help you guys. So what she told me is that they didn't give her much information about it, but that they said that it was going to the AGs. That was on Friday. That the spending plan was going to the AGs. Which I actually heard before that it was sitting at the AG, so I was confused. So, we have all these different information. So they said it's only going to the AGs on Friday, and then it will take another month for us to start applying for these.
Oh my goodness!
A spending plan going to the AG's office?
It's crazy, yeah. So.
Well, we'll ask about it.
She actually said that she's going to try to get more information on the reasoning behind it, but another issue that's even coming up again is that they're saying that they're going to do it as competitive grants. We're just like, okay, we're all here and we all need help. And
they're going to make you guys fight for it.
Yeah, like why are we going through this, And I guess what they're thinking is because they are given the leeway or
the discretion
on how to disperse the money.
Oh, great.
That they're trying to establish a fair process in the event that there's not enough funds. And I was like, that there's not enough funds. There's 6.4 million. There's 43 centers. Make it work.
Yeah.
there should be
43 divided by 6.4. I got it. Yeah.
Well, I don't know how many daycare centers can stay open and be alive in 3 months. After 3 months,
exactly.
Customers, no funds. It's a fragile.
We'll have parents that are already pulling out.
Yeah, I'm wondering. Okay.
It's astounding to me. 3 months for a small business. My goodness, and there are very slim margins in daycare.
Yeah,
of course.
Anyway, hang in there. My goodness, I'm glad to have met you.
Thank you.
Okay.
Yes, you too,
ladies.
I hope for the best.
Yeah, well, keep us posted. Doc, thanks again. I think it's really cool. She called me yesterday, and she was like, I don't know you. Someone gave me your number, but they told me to call you because I want to make noise about childcare because I have people who can't get it. And I thought that was really interesting that when it hit so close to home, I don't want to say home, so close to work for you.
Well, I don't know that I want to make noise. I would like to get some solutions and some answers because
I like making noise.
For my employee and for all of our businesses.
Right. Yeah. Okay.
I think everyone's going to start realizing how important childcare is, and all other industries are going to start being like, hey, we need to help the childcare industry because we need to get our workers back. And I think it's going to start. It's going to start being a big concern. And I said that before that childcare may not seem like a concern now, but when the workforce needs to return and to get the economy going again, you're going to see how much of a concern it's going to be.
Well, maybe there will be more business owners like me that as things are opening up, it's like we lose our employees because they've got to stay home and take care of their kids. So I hope there's a big roar and that it's effective, and we get our children taken care of and our employees back to work and our economy rolling.
All right, ladies, thank you so much.
Thank you.
Wash your hands.
Bye-bye.
Bye.
Okay, bye. Yeah, 8:20. Definitely. How did we overlook childcare? And I understand that what they did is they kind of put it in the same category as schools. Set it and forget it. Like, yeah, you guys are over there. You got kids? You do it,
Dr.
kids?
Cabrera,
Okay.
and I go back to this because he mentioned this, and he's a member of the Guam Physicians Advisory Group.
Right.
Do you remember that conversation?
Yeah, so the conversation was, I want to say week 2, 3 of COVID, they had come across a situation where nurses, other frontline medical workers were not able to go to work because they didn't have child care. So Dr. Cabrera actually called into the show and put a call out and said, hey,
if you can watch, your niece or whoever, please do so that they can come into work and help fight this war.
Yeah. We actually have a couple of people from public health calling in. Linda called me last night while I was sleeping, and she shot me a text saying, hey, these couple ladies are going to call your show at 9. So I had to call them this morning, like, hey, what are we going to talk about?
Yeah.
Oh, we're going to talk about daycares. All right. 8:21, we've got GDOE Superintendent John Fernandez joining the show in minutes. We're going to do our anthems, and then we're going to knock out the news right here on the KUAM News Takeover, Guam's favorite. It is containing COVID. Good morning.
Keeping you informed, KUAM News brings you Banking 6-7.
Kantaiman tunat nyagi toru ilugar para honra para gloria abiba islasen para honra para gloria abiba islasen para Gitoru tempo e paz para ita dan gini langit na bendición contra peligro na pansafuham Deus protege Islam contra peligro na pansafuham Deus protege Islam
8:23. containing COVID. The show proudly brought to you by Calvo's Insurance, Ambrose Inc., Coast 360, the Bank of Guam, and IT&E. Thank you again for joining us on KUAM TV 11. There's an audio stream, Docomo Channel 10. Also streaming on the KUAM News app and at KUAM.com. And last but not least, on the totally legitimate Edward R. Murrow Award-winning social media networks of KUAM. Good morning to our Facebook Live viewers. Keep it coming here, 8:25. Let's do a dive into the day's COVID-19 headlines from the KUAM News team. Sabrina Salas-Matanani, good morning.
Half a day. Good morning, everyone. On Tuesday, Public Health tested 64 people and 2 came up positive for COVID-19. There was also 1 probable case of the virus reported after an individual tested positive through serology testing at Diagnostic Laboratory Services, or DLS. Hence, it was classified as a probable case. To date, Guam has 169 cases of COVID-19, 5 deaths, and 139 recoveries. Even before it officially opened at 6 a.m. and no more cars are being allowed to line up at the Guam Department of Education and USDA's Emergency Food Distribution Program site at the Teedson Upper Baseball Field. According to Governor spokesperson Crystal Paco San Agustin, there were already the maximum numbers of cars in line for today's distribution. The Emergency Food Distribution Program continues, though, on Friday the 29th. Food will be distributed once again at the Teedson Upper Baseball Field and Dededo Farmers Market from 6 a.m. to 10 a.m. Please note, only 2,000 food bags and boxes will be distributed at each site on a first-come, first-served basis. As of this week, more than $11 million in local pandemic assistance payments has been mailed out. On Tuesday, Administration Director Ed Burns says they mailed out another 6,498 checks worth $4,762,000. As of Friday, DOA had mailed out 8,229 checks totaling $6,527,000. A total of $20 million from CARES Act funding was allocated by Governor Lulian Guerrero for the Programan Salapi Adzudan Itatao, or the Money to Help the People program. The last day to apply for the assistance is June 12th on Public Health's website. We'll have to wait a few more days before the issue of double pay is officially heard before the court. Assistant Attorney General James Canto told the court yesterday that the AG's office was never served. Last week, Attorney Tom Fisher filed a writ requesting the court to order the government to pay frontliners their double pay. He represents police officer Steve Tapasnia. He is suing Gov Guam, Governor Lulian Guerrero, GPD Chief Steve Ignacio, and DOA Director Edward Byrne. Canto represents all 4 entities. Attorney Tom Fisher says they now have over 100 essential employees supporting the case, and this includes a representative within the AG's office. The AG's office, after the hearing, provided the following statement, quote, "While we have repeatedly expressed our support for the compensation of essential employees during these extraordinary times and want to resolve this matter as soon as possible, there is still a process that must be followed. Gov Guam employees have a right to participate in this process, and we respect that right, even when exercised by one of our own employees." The court ordered Attorney Canto to file a response by Thursday, and a continuance was scheduled for Friday at 2 o'clock in the afternoon. Over 600 essential employees in the meantime are on board with the Guam Federation of Teachers to sue Gov Guam over the double pay matter. According to GFT Representative Robert Koss, the union has obtained 605 consent letters they plan to turn over to their attorneys to file a class action lawsuit in the District Court of Guam. Of the hundreds of employees, 10 individuals will be selected to represent the class. The union is suing the government for allegedly failing to pay first responders and frontline workers the mandated double pay in response to the COVID pandemic. The Archdiocese of Agaña's Chancery Office will reopen today after being closed for 9 weeks because of COVID. The Chancery will continue to follow a 3-day work week with the following hours of operation: Mondays, Wednesdays, and Fridays from 8 a.m. to 4 o'clock in the afternoon. In national news, the World Health Organization says countries that open up too fast could face immediate upticks of illness and death. The warning follows the Memorial Day weekend in the U.S. mainland, where the death toll is approaching 100,000. Still, millions ventured out and many did not follow social distancing guidelines. Tom Hansen has the latest from New York.
This crowded pool party at the Lake of the Ozarks over the weekend prompted health officials in Missouri to issue a travel advisory. If you are at the pool, you must self-quarantine for 2 weeks. The unofficial start of summer coincided with relaxed restrictions in all 50 states. After months of sheltering in place, many Americans who ventured out weren't sure what they'd find.
Traffic has been backed up on both sides, and the beach has been packed.
We try to go to different places to see where it's less crowded.
Today, the World Health Organization issued a reminder that the number of virus cases can jump at any time.
We may get a second peak in this wave.
On Sunday, 25 states reported increases in their average new COVID-19 cases compared to 2 weeks ago. 3 of them, Montana, Alaska, and Arkansas, up more than 100%. In California, 150 food processing workers have tested positive for the virus at 9 LA area plants. On Sunday, Minnesota saw its largest single-day increase in the number of COVID patients needing ICU beds. And in Montgomery County, Alabama, the number of cases has doubled in the past 2 weeks.
20 to 25% of the hospital is either filled with patients who are positive or who are suspicious and positive. The ICU beds are essentially totally full.
Here in New York City, the stock exchange opened today after more than 2 months of all electronic trading. Only about a quarter of the staff was allowed back. As New York's Governor Andrew Cuomo rang the opening bell, the Dow surged more than 600 points, with traders optimistic about a vaccine. Travel, entertainment, and retail stocks made early gains, but what is normally a scene of controlled chaos was more subdued under new pandemic rules that include social distancing and masks. Tom Hansen, CBS News, New York.
Nevada's governor, in the meantime, is expected to announce when and how Las Vegas casinos will reopen today. In your Banking 671 report, the Guam Bankers Association is encouraging residents who plan to file for pandemic unemployment assistance to consider opting for direct deposit. To opt in, you're urged to take the following steps. 1, open a deposit account with your preferred bank. 2, collect necessary account information. Be prepared to provide your account number and your bank's routing number. And 3, visit Guam DOL's online portal, hireguam.com, to apply for assistance once they actually begin to accept applications. And that is your Banking 671 report, brought to you by the Bank of Guam and Coast 360.
Thank you. 8:32. Let's get right to it and get Superintendent John Fernandez from the Guam Department of Education on to the show. Good morning, John.
Hey, Chris. Sabrina.
Good morning.
So maybe you could just give us the sit rep on the food distribution. This morning we got the message from the Adelup press secretary that before the giveaway even opened, they had already maxed out the number of recipients.
Yeah. We encountered. Sorry, getting some feedback.
Okay.
But on Friday we ran into this situation down in Petey with all this traffic going way back into Assen and Nimitz. And more cars than we had ever had to deal with in our experience. So obviously there's a deep-seated demand for food support throughout the community, and we're seeing it show up at our front doors. And so I had the team get together and figure out who we could look to for assistance in trying to open multiple sites. So of course, that's hard to do on a dime. So we did get the assistance of DPW. I think they have about 40 personnel dedicated to helping us. And this is really, has to do with unpacking commodities, reassembling them, bagging them, loading them, transporting, and then distributing them. And this week, we weren't able to turn it around for today. So we were able to get a new location, but not enough to run 2 different sites. And today we saw the crowds line up. I heard as early as 5 a.m.
I heard earlier than that.
Yeah.
We had a comment. A lady said she was able to make it through, but only after lining up 3 hours prior to it opening.
Wow. So I know we definitely we were hearing some noise between 4:30 and 5, and of course we've been working with GPD to try to ensure that we try to address the traffic issues. Obviously, we can absorb many more vehicles on the Teton site so that they're not flooding out into the main route. But what GPD did was to count, try to do a count on an estimate on the cars, and then cut the line where the commodities would run out. So that's what happened to try to alleviate the traffic. issues, and then we just wanted to run the operation and see how it went today. I mean, for making a shift to another location and running it in a totally different way, I'd say it was successful. It's just the issue seems to be that we can anticipate that continued demand in the community. So on Friday, we were able to work with DPW to map out and staff up 2 sites. So we'll be operating in Dedido at the farmers market, as well as at the Teason baseball field, and then we're looking for a southern site that we can stand up so that we can have 3 sites in the north, central, and southern part of the island.
How many food boxes and bags did you guys distribute last week?
Last week, I think it was about 1,500 to 2,000 bags, and then today the goal was 2,000, and I believe 2,000 at each site on Friday. Now, this is in addition to we are working closely. I think you might have heard Pacific United. I mean, Unlimited. With Mike Luciaco and his group. They want a separate contract with USDA, but they're working hand in hand with us to try to maximize the distribution. They're bringing in about 6,500 boxes of fruit per week, and then I think per month 4,000 boxes. These are 10-pound boxes of frozen meat and frozen cheese. So we're trying to factor that into the planning going forward, and that we anticipate more commodities coming in as part of the federal relief programs over the next few weeks and months. So this is not just a week. This week is going to be a situation that we have to plan out for and try to staff up, for the next several months.
So for so for the next several months. And do you have to reapply every so often?
No, not for us. I mean, I think Mike's group is that came through a contract and bidding process. For us, we happen to be the state agency for the distribution of food, of these emergency food commodities, which is kind of you think that someone like another agency would be more appropriate for doing this, but it happens to be the responsibility we've had for many years. And in this situation, you can see how it's being impacted by disaster and by crisis. So what I understand the federal government is doing is buying up a lot of the excess produce and from the farmers, and buying up extra supply of commodities and so forth, and then they are pushing them through the distribution channels to the state agencies.
Yeah, and that's what we're talking about this morning, John, was that CARES Act funding. The guidance allows for mass feedings and food assistance. So obviously, where you guys are doing with the commodities, but I mean, God, it just doesn't seem like it's enough. So we're wondering, when do we start buying up food or using that mountain of federal money to try and get more food into the hands of people who need it?
Well, what we're hoping to do is again expand the distribution, knowing that we anticipate more commodities will come in, but. Yeah, you're right. I mean, it's really important to get a handle on just how deep and how broad this need is, and we're seeing it. We're seeing the families, we're seeing the cars. I know the governor and lieutenant governor were able to stop by this morning, and I'm glad they did. Obviously, DPW coming to help, and GPD's assistance was very welcome.
Right.
And we are discussing right now the potential activation of the Guard.
Okay.
So hopefully, with those efforts underway, we can deal with the situation now and have a better system for distributing the commodities, and then getting a handle on just what this need looks like out in the community.
Right. And John, so Friday, when the pictures of the lines, I mean, going all the way to Assen from PD, and then all throughout the other roads, like you said, when these pictures started circulating, you saw or at least I saw over the weekend. We had your oversight chair writing a letter to the governor saying, hey, where's the Guard on this? Hey, da-da-da-da. And now, come the first giveaway of the week, we get a text from Adelup giving us the info that, hey, we're turning away people, we ran out of food. So how did the evolution go from this being a GDOE on Friday to now we have the involvement of, different partners, I guess you'd call them?
Right. Well, I think part of it is, I just think that we just have to realize this is a community issue. It's not a DOE issue. It's not a village. It's not PD and whether PD can improve its traffic flow. it's really a broad issue that we have to deal with during this critical time where the economy is underwater and we're trying to, and families are just trying to survive and get by and get through with all the assistance that we hope is coming. So, we've been handling the school meals and trying to make sure that we're trying to make it as the least disruptive as possible, working with the mayors and working with the police. When we decided to open the PD shop up, it's really when Mike approached us and said, we have all this produce coming, and I said, that's great to get it out there, but we can't overload the school sites. So why don't we go ahead and open PD? And normally when we open the PD warehouse, we do encounter some traffic issues, but it's really in that nearby area. So, reaching out to Mayor Allig and reaching out to GPD and DPW for assistance around that area, we would be the norm. And so we reached out to them to just kind of work out the site. But to see that the lines extended way into Aston and Nimitz Hill, that really wasn't, anticipated. Only because, we do have regulars who take advantage of the food assistance, but it just hasn't been, at this magnitude. So realizing that, that in addition to what the lines we're seeing at the school meal sites, I reached out to the Lieutenant Governor and said, we really need to kind of think through a comprehensive food support plan, and I'm going to need help. My team's saying we need manpower. We don't need help planning it. We don't need help, receiving the food. The food's coming in, but who's going to, unload it? Who's going to bag it? Who's going to get it loaded and transported, distributed? We can't run multiple sites with the current capacity. So I know the Lieutenant Governor volunteered the DPW to help with immediate assistance. So Jess Garcia, I know Don Munoz has also been a part of that, have been kind of helping to mobilize immediate support. But I think we wanted to see how this week went before we ramped up and to see.
Don Munoz or Dom Munoz?
Dom.
Oh, from the port.
Right, from the port. I think the Lieutenant Governor has asked, where can we get the additional manpower immediately to see and help plan this out. And then I think with that, we discussed, I know the Vice Speaker, at our budget hearing, on Friday, we were hearing the aftermath of the morning distribution. So senators were asking about the plans, and I, informed them. And I know the Vice Speaker Nelson called me over the weekend and suggested that the Guard be used just because of their expertise in logistics and so forth. So I did raise that issue with Lieutenant Governor, and it is something that's in the planning, it's in the works, and hopefully we can see if we can activate that support soon.
Yeah, there's a whole process because I reached out to the Guard over the weekend for a request for assistance, and they sent me a flow chart. That's pretty interesting. So I just thought, why aren't they out there helping? But there's a whole process where you got to put in a request or whatever.
Right. So again, like I said, it's what the noise that we hear a lot, when we have these operations running is the traffic, the inconvenience that's happening because the cars are lined up and so forth. And I want to really shift the attention to, it's not necessarily about the operations. We can always improve operations, but the fact that you've got 1,000 cars lined up at 5 a.m. in the morning to get food support, that's the real issue. And so
it is, yeah.
Yeah, and I'm glad I did welcome the Governor and Lieutenant Governor there, to come down and see what's happening with the families that are lined up. I think that's really where we're going to get a real handle on what the need looks like out there, and get a feel about the sense of urgency we need to move with.
Maybe that's going to be their next commercial, is the governor at handing out food bags at the. John, do you have any idea how many people were turned away though? Because the comments are kind of blowing up about it. So.
Yeah, like I said, the demand is great. So I don't know how many people were turned away because it happened very early in the morning, and PD was at the point of decision making there. But again, we understand that if we saw all those cars lined up on Friday, and we saw similar issues today, we can expect to see a crowd. Hopefully, it's not as much, but I'm anticipating. Always prepare for the worst, which is to see much longer lines than we have bags to accommodate.
Right.
Hopefully that's not the case. We hate to turn anybody away, from a food line. That's just really not ideal. We definitely would, don't want to be in that situation. But right now we're just kind of limited by the capacity we have to push this food out, and we'll be better on Friday. We have 2 sites open, and hopefully that'll give us a better handle on, the northern need and the central need, and then we'll be working on a southern site soon.
Okay.
All right, let's talk graduation. I know that you had actually broke that on this show. I think the last time we had spoke, you said that you put it out, and they had the response. You put it out, say, "Hey, what are we going to do?" And the response was, "What are you calling it? Grad and go or something?"
Mm-hmm.
Right. I was calling it grab and graduate, but the team, I guess the principals like the grad and go, which that's a good. It's another.
It's not bad. It's not a bad idea. I mean, yours was pretty cool, but
I just had them. I had just envisioned them just grabbing their diploma, and heading
Mm-hmm.
on. But grad and go is a different connotation, but same feel. So.
Right. So how's this going to work, and when are we going to see the plans for this?
Like our high school graduates they're up. First, they were looking forward to the culmination of their years in high school. The big celebration, recognizing their accomplishments. And I just want to let everybody know out there that we feel the same way. I mean, this is kind of it's busy time of year, but the fun part of the year is getting out there, awarding the diplomas, watching the different schools celebrate in their own different way, seeing the best and brightest, our Valleys and Sallies, our those who win the awards. Those who are headed to GCC and UOG right after, who got their plans sorted out. So it's a really good time normally in the school year to celebrate and wrap up the school year. Unfortunately, we're not able to do that, and so what we did is we just let everybody know that Plan A wasn't going to work, and we wanted to allow them some time earlier this month or last month to start planning for Plan B. So that Plan B happens to be for all the schools. Basically doing a drive-through type of grad and go operation where they facilitate the graduates coming up in cars, going up to a stage, exiting their vehicle to get their diploma and to get a picture, and then they will exit in that vehicle and exit the campus. So that seems to be the plan for every one of our high schools and also for JP Torres Success Academy. Most of the schools, I believe, except for one, will do live stream. The other one, I think Okudu will do a video that they will distribute later. But all of that is being arranged and worked through so that we can put it out on DOE social media. So we did put out a schedule. We're telling everybody just kind of, just be flexible and let's celebrate in different ways. But my favorite, alternate ceremony that I was able to catch for one of the students is they held their own family graduation. And what I thought was great was they had someone substitute both for the governor and the superintendent. And the substitute had a lot of hair, which I appreciated.
So it wasn't an accurate depiction.
But I appreciated that little, having someone stand in for the superintendent and just celebrate in their own way, the graduation of their students. So that was nice to see. But, we're all going to have to do it in our own way this year. It's a strange year. It's a different year. But we're gonna have to adjust, and that's what we want to teach our kids. Be able to move forward, keep moving forward, no matter what life puts in front of you, no matter what those challenges are. Yeah, we can complain and we can be sad about it, but at the end of the day, we want to make it productive and positive, and so we got to keep moving forward and find ways to make things happen.
Where are we, John, with the conversation for the upcoming school year?
Well, we're in the middle of it, and boy, it is quite a task. I'm very confident in the team we have assembled and all the players on that team, from the administrators, the staff, the divisions, the leadership team, and those who've inputted. We've had student and parent input so far. I'm very confident because all the things that we're discussing. Every time I look to the mainland or to another country and kind of look through the issues they're challenged with, we're all dealing with it. We're dealing with the same ways, and we've got it on our radar. There's nothing we're missing. It's just a matter of adapting, the situation to fit our needs here on island. So, we're thinking through, the safety part first. What is it going to take to meet the minimum requirements, in our estimation, the minimum requirements to be able to open any of our facilities? So this year will be different. It's not just about getting your school facilities up to code, making sure they're clean and making sure that things are fixed. Now we're talking about protective equipment, things either being installed, supplies being provided to our nurses, enough masks and cleaning supplies to go around for teachers, for students, looking at making sure we get those in before we declare ourselves ready to open. The second issue is really evaluating the impact of social distancing. So with social distancing, If you can't get more than, let's say our typical class is 25, 30 students, and you can only fit 10, students into the classroom, to under those guidelines. Now we're talking about, alternate schedules. What does that look like in terms of students who are able to go to class face-to-face, versus having to rely on distance learning? That'll be probably the toughest part, in my estimation, is trying to figure out how to run a hybrid, face-to-face and distance learning, education system. Not because we can't handle it at the schools. I think we can handle it, and we come up with great ideas regarding how we, do distance learning remotely, online, through PBS and all of that. The hardest part, I think, is going to be the parents, and that's really what concerns me. As a parent, how is it going to impact my household? How is it going to impact my employment situation? Am I going to have to stay home and watch my kids who aren't able to go to school every day or all day? How do I facilitate teaching at home? I mean, how am I going to learn and keep up with my kids' work? And if I have multiple children in the household, it just, that multiplies. So that's my biggest concern for the team, is really understanding and thinking through the perspective of the students and the parents as they enter this new environment. Because I think our administrators, our teachers and staff, with all the experience they have, they can adjust. Mm-hmm. But we're really talking about our customers, our parents and our kids, who have to adjust to this new system and not just go through the motions. We want to make sure our kids are learning. So that's the biggest challenge ahead of us.
Do you have like a targeted date when final decisions are going to be made?
Yes. I mean, as tough as this situation is, we've set a deadline for having all of these decisions as much as possible, right? Because we're not the only ones making decisions that will impact the start of school. And we have the governor declaring, PCOR 3, which would be the first condition to allow us to reopen. So there are things that may not be in our control with regard to the health situation, but we're planning to put in place our plans and finalize those plans and recommendations by the end of June.
Okay.
And the reason why we want to do that is we want to, again, it's going to accelerate our work. We need the board to meet a couple of times then during June so they can make some of the policy decisions that we need. And then we want to have some time to communicate, all these plans to our parents, our families out there. So we don't want to just, agree to it one day and open up the next week. We're going to have to spend some time really helping the whole community anticipate, envision what it's going to look like, and start to make the adjustments. We had a conversation earlier, and there was some comment that we want to make sure our parents are are going to be okay and are going to be satisfied with the plan. And I just have to set the goal more appropriately, which is we're not likely to have a plan that everybody is going to be happy about. This is a different year. Everyone's going to have to sacrifice and adjust. So that can't be the goal that everyone's going to be happy with. At the end of the day, the goal ought to be that we're transparent, that we're communicating to our stakeholders as much as possible, so that people can begin to plan and make the adjustments much earlier than if we were to spring this on them last minute. Right. So we can bring everybody through that conversation. Then by the time we do open that first facility, people feel more comfortable about the plan. They feel more assured about the safety precautions that we're taking, and they can understand how their lives are going to be impacted and make those adjustments accordingly. So it's not going to be easy, but that's the only way I can see us moving together to get it done.
John, what about those parents who are just not comfortable, PCOR 3 or whatever, with sending their kids to school?
Well, that's what I'm saying. I think at the end of the day, we are kind of along the leadership team. We did this probably over the last several days. We had a conversation about how many students would you guess might not show up on day one. And my guess was, given today's circumstances, my guess would be out of a class of 25, you could anticipate that at least 5 might be absent that day, just due to concerns about the safety.
Right.
Could be higher. I mean, just depends on the circumstances. But that's 20%, right? So if you can imagine 20% of kids not feeling comfortable. Could be higher if the situation worsens. And the only way we're going to get it lower is not simply to put a plan in place, but really to provide that assurance and that communication so that it's not just safe, but that people feel that safe, feel safe, feel that confidence that the people at the school are going to be able to take care of their children. So that's the extra effort we have to put into this.
John, we also had a question in the comments here. What happens to, and I guess these would be like non-appropriated funds raised for senior classes and such?
So we've communicated the rules to to our school administrators and to the classes. Hopefully, we'll make sure of that. But really, what has to happen when it's not appropriated funds? These are the funds that are raised by clubs and definitely by the senior class. They've raised funds for graduation, but now we're not doing the traditional ceremonies. So it's kind of changed their their plans. With regard to the non-appropriated funds, and we ran this through our internal auditor to make sure we had the proper guidance. What's very key is that the club or the organization or the class take an active role in determining the use of the funds that they worked hard to raise. So we're not letting teachers or administrators just automatically decide, hey, this is what we're going to do with those leftover funds. We want the students to have a role. And then, of course, we set a deadline for the students, whether they do it virtually or however they want to communicate, kind of determine how they want to use those funds. So I think a lot of the classes are focused first on let's get this graduation ceremony worked out and figure out how much that's going to cost. And then we'll know how much is left over, and then we can figure out what to do with those funds. Mm-hmm. So I think, by the time we hit midsummer, those decisions will be made with the leftover funds. And I think students have asked whether we can donate it to a good cause, a charitable organization. Can we put together senior gifts? There are a whole bunch of ideas that make sense. And then there are some ideas about, can we save this and come back in 6 months and do a reunion or some kind of gathering. Those are more difficult to get done because you start to lose students. They're off island. They're going to college. There's no organization at the school to keep this going. So I've communicated those kinds of things are going to be less realistic.
Mm-hmm. Can you give us an update on the 54 million in I think what federal money provided to GDOE?
Right. So earlier it was Memorial Day. It was a Monday. So it was a holiday, but given the shutdown and the quarantine situation, nobody really feels any differently sometimes, other than making sure to memorialize our soldiers who've given their lives. But on the other hand, the team also was working hard that day, and they submitted the preliminary application for at least DOE's side, which is the $41.5 million, and the three priorities were again distance learning, using the funds to support the health and safety needs, the supplies and equipment needed, so face masks, nursing supplies, cleaning supplies, and then the third was to support our mental health outreach and strategies for students and employees. So we submitted that paperwork, and we're going to be awaiting hopefully a quick turnaround. They said to target that it's probably around a 72-hour turnaround if everything is submitted. So we'll wait to hear from them within that time frame.
Mm-hmm. So that $41 million, is there a breakdown of how much would go to non-public schools, or it's all lumped in together?
I don't have the exact numbers to the dollar, but it's around 31 million, 31.5, I believe, is to the DOE traditional schools, and then the remainder would be allocated to the nonprofit private schools, including Catholic schools and the other private schools around the island and the charters. Mm-hmm. And that allocation is the whole allocation is basically done based on enrollment, on the official enrollment from last September.
Mm-hmm. And you said distance learning, right?
Correct.
So what are we talking about? We're talking about like laptops, iPads,
Wi-Fi.
Yes. Mm-hmm. So we have about I would say about 7,000 laptops right in the pipeline to be ordered and brought in, and then we were planning for more. We're talking about some of the retrofitting of classrooms to ensure they're able to accommodate the technology. Strengthening internet access. I think our goal is to try to shore up our schools as basically as community hubs for internet access, including Wi-Fi. So that's in the plans for trying to expand our ability to address distance learning online. We also want to use some of those funds to prepare hard copy materials as well, because as you know, we're not going to solve the internet access issue overnight. So as part of the phased-in plan, we still envision that there will be hard copy materials that will need to go out. So we want to use some of those funds to purchase some of those workbooks and so forth to help our students either who don't have access or just to complement their learning by giving them things that they can bring home and complete and turn in. So that's really the gist of it. I mean, again, a lot of schools are going to be focused on bringing in equipment, laptops, mobile carts, and then again, internet access being a key part of our strategy. And I believe the governor, I know the lieutenant governor in our conversations is looking at their $12 million to see what they can do to shore up internet access out of the villages, out of the, in the homes. So we're in active conversations with Lieutenant Governor, I know with UOG and GCC at the table as well.
Okay. All right. I think the AG too has jumped on. Sorry. Anyway.
Well,
Yeah.
well, we do envision a meeting. I think the Lieutenant Governor's trying to arrange it with some of our telecom companies to get a better understanding of the access issues. I mean, that's not really in our area of expertise. I mean, I think we can do our best to shore up the school so that maybe if everything works well, then we can open our campuses and provide access for students who want to be on campus in their vehicles to access the Wi-Fi or in some other arrangement. But beyond the campuses, when we're talking about parts of the island where access is not as prevalent in our housing areas, where we might be able to see what we can do to alleviate the cost of internet access, those types of discussions, they have to involve our telecom providers and really understand what the right strategy would be.
Just for clarification, so you guys received $41.5 million, but you have to submit a plan, and then that plan has to be approved before the money is released.
Right.
What if they don't approve it?
I think that, obviously the feds are trying to push the money out. I just think that they want assurances as to how that money will be spent, because they understand that there are going to be a lot of governments going through revenue issues, right? So as part of this agreement, not only do we have to lay out a plan and priorities for using these funds, there are also the number of assurances regarding the accountability for the funds, who's going to be responsible for all the fixed assets that come through. There's also a maintenance of effort requirement that the government provide. I believe the language is the average of the last 3 years of appropriations. So they really are intending for these funds to supplement the local budget, not to replace the local budget. So that's going to be a discussion that I guess we'll continue to have over the summer.
Yeah, and then what kind of local budget are we going to be looking at for you guys? Wow.
Right. I mean, I think what the feds are going to be looking at is, if you've got $42 million and you're going to be putting it into technology and all these other, protective equipment, and then we see that the local government cuts you by $40 million, we're going to have to, intervene and we don't know if those funds are going to be made available because they're not meant to give the government, the local government the opportunity to just cut education funding.
Right. Yeah.
They're trying to do what they can to shore up teaching and learning in this tough environment.
Yeah.
Okay.
Okay. Well, thanks, John, for your time. Anything? I got a call from Mayor Rudy. He wants me to pump FB Leon Guerrero grab-and-go meals available. He says it's been kind of slow up there, and I don't know if we didn't get the word out good enough or.
Well, we're seeing some ebbs and flows. So I think as more, and this is the hard part. What happens when on the day that commodities come out, right? Are parents now being forced to decide, do we go to the school or do we go to Teason? That's the thing we got to sort through, and it's really tough because we're serving school meals every day, but we don't want the families to have to make those types of choices if they don't have to. But I think that's what's going on. We open up a commodity site, and parents are saying, instead of going to school meals, why don't we go get a bag of commodities that might last longer? And so we'll pay attention to those numbers. Let me also, if I could just thank, today running this operation at Teason, really appreciated the assistance of the Lieutenant Governor and Department of Public Works and GPD to help us on this site, as well as I believe the mayors were there, but definitely I know Mayor Paco came out to help set tents up. I know we're in Barragata. I know that Mayor Blas is having to work with us on the traffic. So just want to extend the thanks to the community partners who are working to help us get the food out there to our families.
Well, thank you too, and GDOE. So.
Right. Yeah. Good job, John.
Yeah.
Okay. Thank you, guys.
All right.
Okay. Wash your hands.
Good morning.
Okay.
All right. Bye-bye.
Superintendent John Fernandez. 9:04.
What?
I'm just checking because I'm just gonna finish my thought on the Attorney General.
Mm-hmm.
There was something released that he came out with yesterday.
Oh. Yeah.
Yeah. He's jumping on another lawsuit.
I don't know if this is a lawsuit.
Or something.
It's petitioning,
Yeah.
I think, Congress. I can't pull it up.
Yeah, so it's something with all the attorney generals are pushing for more internet access. I mean, it's not like it's not the most important news, but I just thought it was funny. Like, let's just
really
put
want me to
something
read
out.
this?
No, I don't. I'm just saying, yeah.
Yeah.
I was wondering, like, when you become attorney general, is there a newsletter? It's like, hey, jump on these lawsuits. Oh, we get us on that PFAS one.
Yeah. So just real quickly, so Attorney General Levin Camachos joined 38 attorneys general in urging Congress to help ensure that consumers have the home internet connectivity necessary to participate in teleschooling, telework, and telemedicine as part of any additional legislation that provides relief and recovery resources related to addressing the COVID-19 pandemic. While Camacho and the attorneys general have lauded independent efforts of various companies to increase internet access by waiving late fees or even providing free or discounted access to students and medical providers, such efforts are not sustainable. Ultimately, the attorneys general argue there needs to be a national solution.
Okay, well, there you go. So he's doing that, and here locally, we got the superintendent and people discussing it with the telecom. So it looks like they're covering it from all the angles. 9:05. We talked about daycares earlier, Bree.
Yes, we did.
And I want to bring on Tess Archangel and Elsa Perez from the Department of Public Health and Social Services to discuss the guidance. Good morning, ladies.
Good morning.
Is this guidance coming from Public Health and CDC regarding daycares, correct?
Yes.
Okay. Could you guys speak up?
Okay.
Okay.
Can you hear me okay?
I can hear you. Tess.
Yeah.
Tess,
Yes,
give me a 1-2 1-2.
Okay, I can hear you clear.
Okay.
Okay.
All right. Can we hear each other?
I can hear you clearly.
Okay. Who is your favorite male on the radio on I-94 right now?
Chris Barnett. Chris Barnett.
Okay. Just checking. The line is clear, Bree. The line is clear.
I'm glad we established that.
Right. So just tell us what are the guidance? What guidances? Is that the word? Do we have for daycares upon reopening, ladies?
Okay. If you're talking about specific guidelines with regards to reopening, DPHSS is still coming up with the guidelines. It has to be in conformance with the federal guidelines also. So though we have CDC guidelines, that needs to be specific for child care. So we're still coming up with that.
Have you received the guidance that I think the Giving Tree and the child care organizations have submitted? Have you had a chance to review that? Because I believe they were mentioning earlier that they were written with CDC guidelines and other federal guidelines taken into consideration.
I have not read the one from the Giving Tree.
Mm-hmm.
I have read another one from another provider with their tentative plans on what they plan to do when they reopen to be to have their facility in place to protect the children, to protect the parents and employees.
Right. And so, ma'am, does it work that the individual businesses give it to their chamber reps, and then the chamber reps bring it to the recovery council, and then it goes to you guys? Is that how it works?
It's kind of different because, for example, like the cosmetology, they have a board. With childcare, there isn't a board. When daycare is to open, they have to go through the licensing requirements, which entails getting inspected by Division of Environmental Health, Public Works. They have a whole slew of agencies that have to ensure that they're in compliance.
and there's local regulations in statute on what they need to comply with. But with COVID, it's totally different. It's a totally, in fact, I was just sharing with Tess, we did have a conference call, and some of the states were actually sharing that although CDC has all these things in place, it's not that specific to childcare, and there aren't really straight regulations that the federal government has put into place specifically for childcare for reopening. And I'm pretty sure it's because it's kind of very too soon, or this thing is happening so rapidly that it's really kind of hard for the industry to just I guess really formulate real guidance that's really safe to reopen. I heard from one of the providers, and it actually came from a provider, that in Texas a facility opened, a child care center opened, and 60 people were contracted, and they developed COVID, so they had to shut down. So when we reopen, we really need to be very careful because this disease is very, I don't know.
It's very contagious.
Yeah,
right?
very contagious, and it's going to affect so many people, the children especially, the providers themselves, and the parents, so.
And at the same time, because we're dealing with children, we really have to monitor them closely, unlike the adults.
Yeah.
So we really need to be very careful in developing guidelines, a plan for the daycares. It's totally different.
Right. So let me, because it kind of sounds like you guys are saying, oh, no, hold on a second. So the guidelines that we have in place, although they don't specifically, like you said, deal with childcare, what type of guidance would you guys give to maybe strengthen those guidelines that we have? And are you also confident that the daycare centers, like the businesses, can come up with their own ideas, and then you guys vet it and say, no, that's not going to work, or oh, we like this, or whatever?
No, definitely it's not like that. We need to assess all angles. We need to assess all guidelines, all plans that they're going to submit to us, and come up with the best solution. 10 heads is better than one. I cannot come up on my own. These are childcare centers. Basically, they deal with children, and they know how these children act. They know how these children interact, and if they can show how they're going to prevent that, the physical distancing, the sanitizing, the monitoring, then definitely we have to put that all together into consideration and show it to them, show it to the department's director and to the governor for them to be ready to open.
So is there a sense of urgency or anything, ladies? Are we trying to maybe proactively reach out to these providers? Because, as you know, the governor is reopening the island, and that means people got to go back to work. But if there's nobody to watch the kids, ay nako, what are we going to do?
That's true. As we said, we're coming up, the Department of Public Health is coming up with a guideline, and at the same time, there's really no concrete guidance from the Fed on the federal level. So we're trying to communicate with ACF with regards to that. We cannot just say, yes, this is a good plan. Who are we to say this is a good plan?
Your public health.
So these guidelines weren't being considered the same time the decision was made to open into P-Court 2. Did nobody realize that we were going to need childcare when we start reopening the island and businesses?
Yeah, we do consider that, but at the same time, as I stated earlier, there's no concrete guideline for childcare.
Mm-hmm.
So we are very cautious because we don't want, yes, go ahead, we have a plan, open them, and then something happened, there's a surge, that like what Elsa stated, what happened in Texas, people.
So, but has there been any verbal communications with these child care facilities? Because I want to say that, what's her name, Melanie? Or Lonnie, there is a group. I don't remember what the name of the group was.
It's like a child care council.
Child Care Association.
Thank you.
Right. So has there been any verbal communication with this child care association?
We do have a licensing office.
Mm-hmm.
Licensing officer has been really communicating with a lot of the providers.
Mm-hmm.
What the providers want to hear from us is, okay, you can open, but we are not in place to say that they can reopen.
Right.
There has been a lot of communication, and I hear them, and I understand that, but I guess the answer that they want to hear as to when can they reopen or open, that answer, it's just, we're not ready to give that yet.
Mm-hmm.
Well, Tess, you can go ahead.
It kind of sounds like you guys are flying blind here if there's no real guidance from the federal government, and you're saying that you're not the entity to make that final determination. What are we going to do then?
As we stated earlier, the Department of Public Health is coming up with the guidelines, and that guidelines will be reviewed. And at the same time, definitely we have to ask the federal guidelines. The federal people will have them review that guidelines too.
So are we talking weeks, a month, or any idea?
Elsa can attest to this. When we're dealing with federal people, it takes time. That's my honest answer.
Well, thank you for being honest, Tess.
Elsa can attest to that.
Right.
We have been asking guidelines from them. It's because they're dealing with a lot of states too.
Right.
And call after call, conference call after conference call, even if you email them, the response takes a while.
Mm-hmm.
And we cannot blame them.
Something else Lonnie mentioned was that these child care facilities, people aren't even allowed to go inside to clean or disinfect, and is that true?
No, they can. They can do administrative work. Yes, they can. In preparation for opening, either in Core 3 or Core 4, they can. As long as they practice, of course, if they're going to have some staff there who assist them on cleaning, as long as they practice physical distancing and sanitizing, they can.
But only in P Core 3, you said. Only in P Core 3, not now.
That was the directive that we had received, that they couldn't go in. Now, however, there has been guidance to say that they can now go in to do essential work such as administrative. But the initial instruction was that to be safe, those things couldn't be done.
And that was just kind of to minimize the risk and the spread, right? Potentially.
Right.
So, administrative, does that mean cleaning? Can they go in and like clean their places or what?
Mm-hmm.
Okay.
Yes, in preparation, yes.
Yeah, but again, I just want to make sure, because that was the guidance that initially we have received, that those functions were not to be done.
Right. And so when did that guidance change? Because the daycares, at least the couple that we spoke to, are still under the old guidance.
Yeah.
Jess, go ahead.
We just had a conference call with our DEH chief, and he stated that yes, they are allowed to do administrative work, essential administrative work.
When was this, Tess? Just yesterday?
Today.
Today, okay. So it changed today. Oh, because you're saying like, oh yeah, it's been changed. They can go in with change right now. That's why they don't know. Okay.
Surprise.
Yeah. Hey, surprise, guys. Go clean your area. Now, Gus Guam.
So this is what, Tom Nadeau?
Yes, but I guess because we asked him, I guess Heidi, I'm not sure when Heidi last communicated with them, but then again, because that's the height during those time, if that was mentioned, that was the instruction provided before, is to prevent, of course, because there's not much guidelines on what they have to do during, that was in March. So it's very fluid. You know, at this time, we're allowed to go out, but as long as we have masks and there is physical distancing, yeah.
All right. So
wow, I don't really know if we have any more clear. Are we any more clear? So we don't have any guidelines. You guys are developing the guidelines.
but there's not necessarily any federal guidelines for you to follow as you craft the local
For
guidelines.
childcare, no, there's no specific guidelines for childcare.
So when you guys come up with your guidelines, Tess and Elsa, you have them. Are you gonna send it over to the feds to be like, hey, is this okay, or?
Definitely, we still have to get guidance from them, and whatever the daycare's plans are, we are going to review them and see what's best for everybody.
When you say federal, who are we talking about?
ACF.
And I'm sorry?
It's ACF and the
Administration,
Childcare.
and Family.
Okay.
Okay. Not adult correctional facility.
No.
Gotcha.
No.
Administration for Children and Families.
Oh, I got it. Right. Okay, so, man, I don't feel like I want to hang up so you guys could work on those guidelines so that we could get some daycare out here.
Now I wanted to follow up with Tess.
Yeah.
How is you're in charge of the SNAP and the other public assistance programs, right, Tess?
Yes.
Are you also administering the Programmen Salapi Zuden Itatau?
I would not say we're administrating that. We co-partner with Department of Administration.
Right, you accept the applications.
Yes.
Right.
We do accept the applications. We verify if they're under our program, and so we determine if there's some duplications on those. But ultimately, Department of Administration do the review of those applications and do the check right.
Okay. Have you seen a lot of people applying online?
Oh yes, a lot. I mean, one. I think for 15th, that it's supposed to be the last day, we received more than 2,000 applications just for one day. Yeah, on May 15th.
Wow.
Yep. Just on that. Currently, I think what we've been reviewing up to the 13th, we have 3,000 applications. That's application. So we need to assess each member on it. I mean, household members, we also assess and check the duplications of those applications. We do found some.
Oh, you found some duplicates. How many people are currently in the program?
Under SNAP?
Right.
Oh,
aside from the new applicants that are eligible for the program.
For Programmen Salapi, as I said, it's Department of Administration.
But do you have an estimate on how many are currently in the program?
Well, I could only speak for the SNAP clients. With the SNAP clients, we did send, if I'm not mistaken, 12,000 applications. 12,000 recipients of SNAP were sent to DOA for check right.
Wow. And that's not and that's not including the...
That's only for the Salapi program, right?
Yeah, and that's not including those who's not under our program.
So how many
new
total
applicants.
SNAP recipients are there on island? And then Tess, so can you give us the total, and then also from the start of the public health emergency, do you have that data?
I do have the date. I have that data, but unfortunately my computer is asleep, so I have to open it unless you can wait.
But Tess, I mean, I'm looking at the numbers. I mean, we average about 14,000 cases for SNAP. I'm just talking about SNAP.
14,000 per
month.
Per month.
It spiked in April, but then it went back down to the 14 some. We average about 14,000 cases or households.
Kind of, yes.
And that was sent over to the Department of Administration for the Programmen Sluppy program, right?
Yes.
And that's not including the new
applicant.
Right.
Just
Okay.
for cash assistance, no, it's
Right.
not including that.
Yeah. But if they qualify though for the Programmen program, then they would qualify for the SNAP, right?
Yep.
Not necessarily, because we're pretty.
Depending on the
funding.
No, but citizenship and things like that. So it's not automatic that they qualify.
You said the what? Citizenship?
They have to be a U.S. citizen
Oh, I see. Okay.
or permanent legal alien.
For the CARES Act,
But not for Programa Salapi.
Not for Programa Salapi. For Programa Salapi, you can be a non-U.S. citizen and you can qualify.
I see. Okay.
Okay. Well, anything else you want to add, ladies?
No.
You're done?
You know, just with regards to one of the news where it stated that we're not paying the childcare providers. We do. The CCDF childcare providers, we pay them based on their enrollment. We in fact paid in April and March, and we're preparing for May.
Even
for the childcare providers, CCDF childcare providers.
And this is even despite them not having any children to watch.
Yes, we base it on the enrollment. It's not based on the actual attendance of the children.
Right. Okay. Well, that's good to know.
And this is the 14 was it the 6.4 million in CARES Act funding? Is that what you guys are using to pay out the community development block grant?
Correct.
Yes.
Okay.
Okay, so yeah, it's kind of interesting because I think they were talking about how they weren't receiving anything.
So everybody's been paid.
Yes.
Okay.
Okay.
No follow up. Yeah.
Okay.
All right. Thank you.
Tess. Thank you, Tess. Thank you, Elsa.
You also. Okay.
Let's make it a habit. Call back often, okay?
All right.
Okay.
Okay. I'll see you.
Be safe.
Wash your hands.
All right.
Okay. Bye.
Bye-bye.
9:27. Always a pleasure. The ladies from Public Health.
Yeah.
We got to take a little break, Bree, and then we're coming back. You might talk gyms as the conversation has been about daycares. Wow, I don't know what to make of that.
I'm confused, right? So Lonnie's saying they weren't getting paid?
I don't know if she gets the block grants or other daycares do, but there were daycares. I mean, maybe they don't know they got to
Public Health has
fill
been
out the
paying
paperwork.
out.
I don't know, yeah.
But there's they're working on the guidelines.
They said that there weren't really federal guidelines, so they're coming up with
their own guidelines, and then childcare facilities can submit their own guidelines.
Right. Yeah, that's what they said. And they've already reviewed a couple of those, right? So
I think she said one.
Yeah. So wow, good luck with that. I'm not really even sure what that means as far as a timeline. It seems like it's not going to happen this week.
Maybe they should just all have like a Zoom conference and talk, with Public Health, hosting it, and people can just ask their questions on what needs to be done, I guess, and what needs to be in these finalized guidelines. So, yeah, that was quite interesting. And a little bit confusing, because I know I was reading on the Congressman Michelson Nicholas's Facebook page and how he was saying that this $6.4 million in community child care development block grant funding has been sitting with the government of Guam since April 14th. And you
that's
just
what he
heard from
said.
Public Health that they've actually been using that money. They've paid for March, they paid for April, and they're getting ready to pay out May to these child care facilities. But it's based on enrollment, not on how many children actually are
showing up, which is zero because no kids are showing up.
Yeah.
I mean, I guess the only way to find out is to ask. I mean, that it was frustrating. Lonnie, the daycares did seem frustrated that they knew we got this $6.4 million, but it looks like it went to public health.
Yeah. Well, I guess because they're the ones.
So
who
maybe asking Adelup wasn't the right call, and Adelup was like, "Oh."
But hey, the new development is that you can actually go in and start doing essential administrative work, which includes disinfecting and cleaning your daycares.
Well, there you go. 9:30 again. We'll take a break and come back with more of Containing COVID right here on Guam's favorite. Good morning.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
Be healthy. Be informed with ITD.
Calling all graduating seniors. Join us by showing your class pride in the celebration caravan you deserve through the island's major thoroughfares. KUAM and its partners want to recognize your accomplishments and help celebrate this pivotal moment in your lives. To participate, email promotions@kuam.com and let's get this show on the road. Special thanks to ABC Stores Guam and The Dungeon.
Be healthy. Be informed with IT&E.
Hey, good morning, 9:37. Coming up, we end the show on a good note. Not that hard to do, as there are just so many people on this island who continue to make a difference during the COVID. The show is proudly brought to you by Ambrose Inc., Coast 360, the Bank of Guam, IT&E, and Calvo Enterprises. Song always makes me think of Guardians of the Galaxy. 9:38. Wow, so we're going to be talking with attorney Tom Fisher on tomorrow's show. And actually, a pretty big show set up for tomorrow. Yes, there is a plan. Good morning. So we wanted to, we'll talk about the double pay, one of the double pay lawsuits tomorrow. The story had come out from the Guam Federation of Teachers yesterday on KUAF News that, Robert, let me get this straight. You guys have signed up, 600 people for your action?
605.
605. How do you choose which 10 are going to be?
Well, we know our members. We know those who are outspoken. We look for those individuals first, and then, of course, contact them and make sure that they're willing. And there's going to be a meeting so they understand their role and responsibilities.
Mm-hmm. Outspoken? What do you mean? Like rebel rousers? What?
Sometimes your client can be your worst enemy.
Mm-hmm.
Put them on the stand and they get amnesia, they can't remember anything, or they get terrified. So, we're looking for people that if they were called to testify, they would be able to speak intelligently about the issue,
mm-hmm.
And make for a good client.
Mm-hmm. When are you planning on filing this?
Well, I felt a lot of pressure from the media and Fisher's lawsuit to try and move more quickly. I think our executive counsel and my attorney are pulling my reins and trying to hold me back. We are following our original course of action, and so we have turned over the 605 plaintiffs to the attorney. He is arranging to meet with them this week to talk about basically their role as a client in this case, and get that squared away. We've been in the process of finalizing the pleadings. I know everybody's anxious and eager to see it get filed, but I think it behooves us to ensure that it's done carefully.
Hey,
Why are we going the district court route?
Okay, so the first set of pleadings that I was giving states district court at the top. I don't know what the final product our attorney will be giving us, and whether it'll be the district court or some other court. But the initial draft we formatted after some other cases where we had success, and those cases were filed in the district court. So I assume that's where we're going, but I'm not the attorney, and I will take his lead on that. So we'll have to wait and see.
Hey, Robert, so these 605, are these existing GFT members, or did you guys get a membership drive out of this as a side benefit?
I like Linda DeNorsh's answer. They are now.
Wait, I think that was Dr. Jenna Menglotnya.
Right, yeah. Don't be putting those words into Linda's mouth, because I heard that's not what she's saying.
I'm sorry.
Yeah, so they are now. Okay, I got it. And you talk about pressure from, I don't think the media is applying any pressure. I think you came out and said you were going to sue, and we're just waiting for the other shoe to drop. And there was a little derail, the press conference thing, which...
There's also a public hearing thing coming up, too.
Right.
Right. That's been really eating at me. I think it was Senator Therese Terloggy who said it was all a charade. That's very concerning for me. We have elections coming up, and I hope it's not all a charade, because I'm not going to have a lot of nice things to say about our legislature if that's the case.
What about Attorney Fisher's lawsuit? Are you guys watching this?
Absolutely. I think by taking our time with ours, there are some real upsides to that. One, we get to watch what happens with Tom Fisher's lawsuit. I wish him all the best of success. There are some elements of this case I'm concerned, may not work out for him. We also get to see what the legislature does, and whether indeed they are going to address the problem or not. Chris, the legislature said that there's going to be an oversight hearing or a public hearing on this Friday.
Right, on the 3 bills.
Right.
Yeah, is it still on, or was it ever even scheduled? I don't know. I don't see any effort to solicit any sort of participation.
Oh, wait, let me look. I thought I had a schedule here.
Is it virtual? Am I going to go downtown and...
It's probably going to be virtual. I'm pulling up the legislature's calendar.
Okay, I see.
That's what they did in session. It was basically to schedule a public hearing.
So then we're just all going to submit written testimony, and a few of us will go on their Zoom?
I would think so. I mean, I think that's how they've had it in the past. But I think you probably have to contact one of the... Who's the committee overseeing this? Is it Senator St. Augustine?
Yeah, I believe Senator St. Augustine is the one who initially stated that he would call.
Yeah, he was the one who moved the motion during emergency session. Let's see. This is virtual public hearing. Wait, what's today? Here it is.
Wednesday.
Virtual public hearing, 9 a.m.
At 9 a.m. So then I need to let all 605 of my clients know that they should contact the senator or participate in this virtual public hearing 9 a.m. on Friday.
Let me make sure, because it does say Friday, May 29th, beginning at 9 a.m. via a Zoom video conference, Bill 357. Where's the rest of the bills?
And is that
Wait, that might be another bill.
Rob, I don't know if can you tell us about who's going to be bringing the suit on behalf of the GFT?
I handed all that stuff over to the attorney yesterday. I know one of my other colleagues has the file. I don't have it in front of me.
Are you able to tell us who the attorney is yet?
Oh, I really want to. He's in the process of moving his office. We're going with Josh Walsh, and I understand Josh is opening up his own law firm, and he's in the process of moving out of the Seville and Tang law firm. So, there is that issue. Mm-hmm. I think it takes a little time away from the case, but that'll be resolved soon.
Okay, so I had to click on each one of these things here on the legislature's calendar. So there's actually a 9 a.m. virtual public hearing, a 2 p.m., a 4 p.m., and a 6 p.m. on the various different bills that have been introduced. So it's not all, I guess, all of these double pay bills all at the same time.
Yeah.
Okay. So like at 9 a.m. it's Bill 357, which is the Vice Speaker's bill.
That was right.
Yeah.
Good one.
2 p.m. is Bill 358. That's also the Vice Speaker's bill. That's just to codify her executive order. So then 4 p.m. is 359, which is Speaker Barnes' bill. And then 6 p.m. is 361, which is Senator Joe San Augustine's bill. So this is all Friday, and it's all over Zoom.
Do you know how to use the Zoom, Robert?
Well, I've been involved with a few, but I'm no expert on computers.
Yeah. Well, I think we're all getting used to Zoom. I know I wasn't at first, but
yeah, Bree has her black belt in Zoom.
No, I don't.
Okay. Well, I'm going to encourage everybody to, if you don't know how to use Zoom, please submit an email or a written testimony in some form to the legislature and share your position on those bills. Mm-hmm. Frankly, a lot of those bills, they give a little and they take away. Mm-hmm. A lot of those senators are taking away other forms of pay, like night differential, for example, or hazardous pay, which, is another issue of controversy now.
Right.
So, I don't want to take anything away from public employees. I just want to get my boys paid.
Yeah. Out of the 605 that have joined in and submitted their names, do you have a breakdown in terms of how many were nurses, how many were police officers, firefighters, and anybody from the AG's office?
Yeah, do you have anybody from the AG's office?
I have been talking with an attorney from the AG's office who wishes to be included, yes.
Wow. I wonder what the AG's office was like this morning. Are they open today? Who's on that lawsuit?
Well, yeah. Those guys responding to all this noise, they're working, aren't they?
So what's the breakdown?
Again, the stats and the documents are with my colleague who I handed the management of the case file over to. I'll tell you what, I will get that, and on our next phone call and our next discussion, I'll give you the breakdown. But, right now, just looking at it, I remember, GPD was like an inch thick, stacks of paper. Every agency had, varying stuff. I'll get the info.
Okay. Thanks, Rob.
Yeah, thank you. By the way, we got a comment here. He looks like a handsome version of John Goodman.
Who does?
They're talking about you, Robert.
Oh, handsome? And that's it?
I guess people are buttering you.
Thank you very much.
They're buttering you up in case you get a favorable result in your action.
I don't think that's going to help.
Yeah. Okay.
Well, thanks, Robert. Was there anything else you wanted to?
Yeah. Is there anything with GFT going on?
well, focusing on this, I'm trying to get my head wrapped around what's going on in DOE. I share the concerns about the daycares. I would let the daycares know that if DOE ends up going double session, probably a lot of parents are going to need those daycares for the other half of the day.
Right.
Yeah, so we got to get those daycares open. We can't just have our little kids running around the streets.
Right. But, public health is saying, we got to make sure it's safe for these children, so.
Right, yeah. I mean, safety first. And no one's saying, hey, let them open right now. Run, come on, kids, go in there. Yeah, we got to safety first. But, I mean, obviously, it's if you're going to reopen the island, then you need to consider that people can't go to work without childcare.
Yeah.
Absolutely. Yeah, it's all crazy. This whole economy is all interconnected.
Right. Yep.
I'm having a hard time going to work without restaurants myself.
Doesn't look like it.
I need a place to go for lunch.
All right, Robert.
Thank you.
Thank you. Wash your hands.
Safe.
Okay.
Great show. Keep up the good work. I really love it.
Okay, appreciate it. Right on. Bye. 9:50. It's 9:50.
Already?
Yes.
Wow.
Where does the time go, Bree? Time just flies when you're in good company, and you guys are the best company. All right, we're going to take a little break, and we're going to end this show on a good note right here on the KUAM News Takeover, Guam's favorite. Good morning.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
calling all graduating seniors. Join us by showing your class pride in the celebration caravan you deserve through the island's major thoroughfares. KUAM and its partners want to recognize your accomplishments and help celebrate this pivotal moment in your lives. To participate, email promotions@kuam.com and let's get this show on the road. Special thanks to ABC Stores Guam and The Dungeon.
Be healthy. Be informed with ITD.
So by living like a star, hotel rich champagne and caviar.
9:58. Good morning.
But no one ever showed me the river.
We're gonna end on a good note.
My
Even though
favorite part of the show.
I just saw something I forgot to talk about this morning, but we're gonna save it for tomorrow. Because now we're just being good. It's a good note. Positive. Positivity. Right on.
Seeing purple?
Yeah, seeing all purple. 9:58. Let's bring up one of my favorite community partners, Juanita Blas of Island Girl Power. Good morning. Oh, did I do that again? Here we are. Good morning, Juanita.
Hi, Juanita.
We just wanted to bring you on, of course, to recognize all the great work that you're doing during the COVID pandemic. And it's a long list. I remember we were chatting on the WhatsApp yesterday, and you're like, okay, so what do you want to know about? We got this, we got that, we got this, we got the garden.
She ran out of fingers.
Jump roping, I need extra hands. And then I said, send me pictures. I didn't know you were going to crash my iPhone.
Oh, sorry, but it's a limit 30 kind of attachment, so I knocked it out.
WhatsApp should up that just for COVID. Like, we're going to let you send 50 pictures because Juanita's sending Chris pictures about all the stuff you guys are doing. And Juanita, just we got 4 minutes here. I want to give you the floor. Tell us about the services you provided, the need they've filled, and the reaction that you've gotten from the people whose lives you have touched during this pandemic.
Well, we definitely haven't been able to open up our regular services. Our thrift store is still closed, and the girls' clubhouse. But we have been distributing isolation family activity baskets. And honestly, it's books and art supplies, just things for the kids to do, things to keep them busy. And we've distributed, it's a total of 250 jump ropes, and there's maybe 30 on the fence line left. And so, that little video of my son saying, "Are you bored in your house? Are you in your house bored?" Give the kids a jump rope. That, people are so happy just to be able to get something to keep the kids' minds busy, but also the peace of mind for the parents. We've turned to fundraising through Guam Home Center, and we have seedlings for sale. It's a donation, 100% goes to Island Girl Power, $4.95 for a seedling, so it's something that we can do to kind of make sure that we take care of our utility bills here at the center and are able to keep doing recovery efforts. We also have a team of ladies that in their own homes are making COVID masks. They're making the cloth masks, the type that looks like the, for nurses.
Right.
And then there's different styles that other people are making. We're partnered with PPE for Guam, so some of the masks are dedicated to first responders and I believe Manamco. So there's quite a lot going on,
right.
even if it's just honestly, maybe a total of 10 people doing various things.
Right.
But great, the impact each person has to just allow us to keep helping the community.
And that's why we wanted to bring you on. Juanita, how much have you heard from the young ladies in the community that you guys offer positive mentorship and, different activities? What are you hearing from them not being able to go to the clubhouses?
It's hard. It's been really hard. That's their social outlet.
She just came out of her chrysalis.
Besides school, and without school and with the clubhouse closed down, it's been pretty hard on them. Many of them have, because we have a WhatsApp group as well and a Facebook page that they connect with. We just send them as much positive information, how to do self-care, activities that they can participate in online, kind of fun, free yoga classes online. They can learn how to do just about anything now. So if they wanted to start crocheting and they needed yarn, then they can come to the center, by appointment, and we'll give them yarn. So it's a thing that with our Island Girl Power members, we'll support and we'll continue to support them through this. It's just we can't open up the center yet.
Right, and but you've found ways to still reach out to your partners and the kids, right? So that's
absolutely. We're just getting ready to kick off our planting kits, so family planting kits, and we're going to be creating them within this month, within the month of June, and be able to start distributing so families can start their own little gardens. And be able to provide just about everything they need for it. And that's through a partnership with Guam Behavioral Health, because Live Life Happy Garden, that just makes sense. And speaking of gardening, our community garden remained open through the whole shutdown. And the only reason we were able to is because people were justifying going to the store for basic necessities. And our gardeners were coming here for their harvest. Mm-hmm. They were getting their food. And so, of course, it was scheduled, and we would limit how many people came at a time. But anybody who rented a community garden plot, including a lot of teenagers, they were able to come and take care of their gardens.
That's great, and that's why we wanted to bring you on and just have you share with our listeners all the positive work that you and Island Girl Power have been doing, and also the partners like Guam Home Center, just to really tell you, Juanita, that you and the gang at IGP, you guys are COVID heroes. So thank you for the work you do.
Well, thank you for letting us, share that with the community. Definitely, a lot of our struggle is getting the word out, so we try to do as much as we can on social media,
right,
and through you guys for sure.
Yeah, well, you got the number. Anytime you want to call, you got something going on, Juanita, do not hesitate, okay?
Thank you. Thank you so much.
Okay, God
Take
bless
care,
you.
Juanita.
God bless
God bless
Guam.
you. Stay
and
safe.
Okay.
Wash your hands. Okay, bye. Always great, man.
Yeah,
Good
she's
stuff.
amazing.
Yeah.
I mean, nothing
How many
stops,
years?
exactly.
God.
Nothing can stop Juanita. She's always hustling. She's always out there. She's always, giving back to the community and helping these young girls. So truly a hero, not just during COVID, but every single day.
On that note, Sabrina, good job.
Good job, Christopher.
Hey, good
Joe.
job to you guys. Joe, sir, thank you so much, Joe, sir. Cansanity, thank you for the empanada run. That's right. This morning's show was fueled by Onadera Mart Empanada. They have empanada, guys.
It's so good. It really is.
Because I don't know, when the COVID started, like, people stopped making empanada and pasted and,
No, I mean, that is like crunchy. It's so good.
I know where to get it, right?
Yep.
See, I know. Hey, when it comes to stuff in your face, PhD right here. All right. Hey, so thank you guys so much for watching again on our Edward R. Murrow award-winning social media networks, KUAM TV 11. This has been another episode of the KUAM News Takeover, Guam's favorite containing COVID. Sabrina?
Yes.
Good job.
You too.
All right. My name is Chris. Adios.
Bye.